Okay, good morning, everyone. I would like to welcome all of you to the Health Services Committee meeting. I appreciate all of you who showed up, and hopefully a lot of the questions that you have will be answered after the meeting, or during the meeting, rather. We have, first we need to approve minutes from the last meeting. Need a motion made by Supervisor Conover, seconded by Supervisor Taylor. All in favor?
Aye.
Opposed? Carried. Okay, we do have some action items to get through initially before the presentation from Centers Healthcare. So I will turn it over to Lloyd.
Okay, thank you, Mr. Chairman. Number one on the agenda is regarding the controller vacancy, and Gretchen will be handling that for us.
Okay. Betsy Henkel's officially started her position as the full-time fiscal manager for the Department of Public Works. As a result, we need to provide for fiscal manager coverage for Westmount, and we propose the following. Hiring a temporary fiscal support person for between 20 and 40 hours a week. This will be for a duration of 3 to 6 months, which falls within civil service guidelines for temporary positions. The rate for the position would be $24 per hour, equivalent to approximately $50,000 per year. This position would come with no benefits. The position will terminate with the sale of the facility unless we come back to the committee. If the committee agrees with the proposal that we put forth, I ask that as this moves forward to the full Board of Supervisors, that it be ratified as of Tuesday, March 17th, which will be tomorrow. We project the expense for the part-time fiscal support person would be $6,000 for the first 3 months plus statutory taxes. Betsy Henkel will continue to provide fiscal support after hours, up to 20 hours per week, at time and a half during an undetermined transition period, likely 3 to 6 months at a projected cost of approximately $8,000 for 3 months. Betsy will continue to handle the complex financials of Westmount and both delegate and train the temporary fiscal support person. And then we will come back to the committee as we get close to the end of the 3-month period, and at that time we'll address the fiscal support needs of the enterprise.
Okay, get a motion to get that on the floor. Supervisor McDevitt, seconded by Supervisor Conover. Any questions, discussion? Supervisor Conover?
Gretchen, your office is recommending this.
Yes, and we are very fortunate. We have located a retired chief financial officer who is very well experienced and will be able to come right in and start working immediately.
Supervisor McDevitt.
Yeah, just on behalf of the board, I'd just like to thank Betsy for her many years of service to our nursing home. A very complicated, difficult job, and we thank you for those efforts and your dedication.
Supervisor Westcott.
Thank you, Mr. Chairman. I'd like to echo that. Betsy, great job. Thank you for your service. One quick question, Gretchen. That rate that you have, is that standard for positions? How did you come up with that rate for the temporary employee?
The $24 an hour, actually, it is, we benchmarked it with a salary survey, but we also had a leave later last year, and we brought someone in for an accountant position, and that was the rate that we had compensated, so we thought it was fair market value for the position.
Gotcha. Thank you.
And I too would like to thank Betsy. Over the years, I've been on this committee since 2006 and dealt with her through the budget process, and she's been amazing. So thank you. Oh, yes, Supervisor Bailey.
I'm going to pile on and also thank Betsy, but I especially want to thank her for saving $300,000 in expenses this past year at Westmount, along with Lloyd. That's just, to me, mind-boggling, the effort they put in to do that. And the fact that most of it was sustainable going forward was very impressive. So again, thank you very much.
Okay, we have a motion and a second. Anything else? Yes, we will move this on to personnel. Okay, so all in favor?
Aye.
Opposed? Carried. Okay. Item 2.
Item number 2, request for new contract with PMP Computer Software. The rationale is our annual software support agreement. It covers our both billing and clinical billing needs. It is a year contract that I recommend we pick up for the full year with the uncertainty of a transfer date going on with the centers. And my biller runs 2 to 3 months behind with her billing, and they will be additional rebills, adjustment bills, and pending coming through once the transfer goes through. So I would recommend picking this up for an additional year.
Okay, motion made by Supervisor Taylor, second by Supervisor Conover. Oh, that's right. You got bumped.
Oh,
sir.
I forgot again.
I forgot all about you.
We gotta change that.
We're only into March and it's, okay, motion made by Supervisor Conover, seconded by Supervisor Westcott. Supervisor Frazier is not here. Yes, sir.
I just, Chairman, thank you, this, statement of accounts that I'm looking at here, $5,888, that's the total cost?
Correct. It's the same as last year. There was no
Okay. I will raise a question. All in favor?
Aye.
Opposed? Carried. Okay, item 3.
Item 3 is a request to amend Resolution 113 of year 2014. This regarding per diem staff, basically in all departments of the nursing home. Historically, we pay people time and a half over 8 hours, and in this amendment last year we voted to do that. However, when we reviewed the amendment, it was limited only to the nursing department, and this is once again only for the per diem people, not the full-times, who automatically get this benefit. So we're looking to, we've been paying this basically the last year. Any per diem who works more than 8 hours a day has been getting time and a half. This is a very small amount of money. It averages about $50 a month, so we're not talking a lot of money here. But we just wanted to clean this up, discuss it with Mr. Dusick, Mr. Afferdu. They recommended we bring it to committee, go through the process, make it obviously retro because we've been doing this, and moving forward, as I said, it'll be about $50 a month, and it'll be for all other departments other than the nursing, which was already included in the referendum, or the memorandum last time.
Okay, motion got on the floor. Supervisor Westcott, seconded by Supervisor Conover. Any discussion? All in favor?
Aye.
Opposed? Carried. Okay, item 4.
Item number 4, request for transfer of funds. These are out-of-code salary transfers, primarily distributing part-time per diem to overtime or vice versa. It's very difficult to budget for a part-time per diem and also an overtime when you're covering a full-time position. So as a result, I transfer funds back and forth throughout the year, occasionally going out of code. A couple of these I chose to go out of code, but basically it's just a cleanup of our per diem and overtime salaries.
Okay.
I should mention the second page is the transfer of full-time funds for my department to a per diem to cover the per diem position, and also the overtime, my overtime position. My hospitalization will be covered by DPW, so I transferred that funds over to the overtime salary as well.
Okay, need a motion. Supervisor Westcott, seconded by Supervisor McDevitt. Any discussion? All in favor?
Aye.
Opposed? Carried. Item 5.
Item 5 is regarding one of our medical staffing contracts that we have. It was signed on in 2012. There's been no changes since that period of time. However, now they have been purchased by another company. That's why we're necessitating the name change on the contract. And they have requested an increase in their fees, which I feel is extremely nominal. It was basically $1 an hour on weekends. The price during the week almost remained the same. So over 2012, I think that's very good as far as them sticking to their original agreement. So basically we have the two issues of the name change. We'll be dealing with a new company, and including their rate increase, which they would like to have effective the 29th of March.
Okay. Need a motion, please. Made by Supervisor McDevitt, seconded by Supervisor Westcott. Any discussion on this item? Not? All in favor?
Aye.
Opposed? Carried. Okay, on the agenda, we're going to skip down to staffing levels, if that's okay. If you could just give us a quick report on that.
Sure. We're still, as always, looking for LPNs for primarily our 3 to 11 shift. And at this time, we are looking for a day nurse manager, Monday through Friday. That's a key position, and that's been open for several weeks now. So we continue to advertise and recruit the best we can. However, these are tough positions to fill. If you look at the papers, every nursing home is looking for good help, and we are no exception to that. So we are doing what we can to keep the staff up, using agency where we have to, but not in excess, and move forward.
I will reiterate that through this whole process, again, you guys have been tremendous over there, keeping unity, and it's been very impressive, so I thank you.
Mr. Chairman, the only other item we'd like to do at this point is payment for retirement invoice, which is just above staffing levels. And then we get that done, and then our portion of the meeting will be over.
Good idea.
I think Mike Swan is going to help us out with that one.
Basically, Westmount received a invoice from the New York State Retirement System for $600,000. They do not have the cash flow to cover that. So at the last Finance Committee meeting, we arranged to have the county loan the money to Westmount to cover this invoice, plus additional amount of money up to $1.2 million to make sure that they have enough cash flow to keep continuing their operation until either the IGA money comes in to cover that or the sale.
Do we need to do that?
No, it's already been approved by Finance and forwarded to the board, so at the next board meeting, I'm assuming that resolution will be brought up and voted on at that time.
Okay. Okay, very good. Any comments or discussion on that? Okay. At this point, we are going to have a presentation by Centers Healthcare. The purpose of this meeting is to address misinformation and correcting the record. The county board, for almost the last 3 years now, has done its due diligence and voted overwhelmingly in favor of the contract with Centers Healthcare. Again, there have been a lot of questions and comments. I assume that we're going to need all the time possible, so we are going to just try to keep in focus on this particular issue. My plan is to, after the presentation, open it up to my committee, and then the rest of the supervisors, and then to the public. So with that being said, I would like to have Mr. Rosenberg come up front here to the podium and start with your presentation, please. Go ahead. Yeah. Okay.
Good morning, everybody, esteemed board members, members of the public, members of Centers Healthcare. Thank you all for allowing myself and my colleagues to make a presentation. I'm going to have just 5 people that are together with me introduce themselves, because during the presentation they will be speaking as well. With your permission, I don't have a problem, we don't have a problem if you want to ask questions that are germane to the topic that's on the board, so that we don't have to save these questions till the end. We may touch upon something that you might have a question and say, I don't understand that, can you explain it again, so we don't have to save it till the end. So I don't have a problem rolling the questions as they come up. So just raise your hand, and we're happy to address them. So just before we begin, I'm just going to have the folks that are with me introduce themselves. Katie, you'll stand at that podium. We'll try to work the room as best as possible. And I'm sorry that I'm giving you my back.
Mr. Rosenberg, just one item of clarification. If we do have somebody from the public address the microphone or the podium, please just state your name so we have that for the record. And if you can, limit it to a 3-minute, 5-minute question, please.
Okay, so I am Kenny Rosenberg, and I am the CEO of Centers Healthcare.
Chief Operating Officer, Centers Healthcare. Morty, I can go to Chief
Katie, you just go to that podium. Morty will come here. So just a brief introduction to our presentation. It's been a long process for us, as I'm sure for many of you as well. Initially, when I started seeing a lot of discussion about the sale, I assumed there was a referendum on whether the county should be in the business of operating a nursing home or not. We can certainly have that conversation. I'm assuming we'll probably have it later. I'm happy to do it. It became apparent as of late that the referendum by the people who are trying to get about 2,000 signatures has become about getting Kenny Rosenberg, getting myself, and Centers Healthcare out of Warren County. And I quote a quote from the newspaper. To the editor, County Administrator Paul Dusick continues to paint a false picture of those of us who are collecting signatures to get the issue of whom we sell Westmount to onto the ballot this fall. First, we agree the county is not managing it correctly. I'm not going to say whether that's true or not. And if we find the right buyer, it should be sold. We do not agree it should be sold to two newly created LLCs generated by Centers Healthcare out of the Bronx that recently purchased Washington and Essex County homes, and whose Medicare compare ratings have since dropped to a single star, the lowest rating possible. So it's not really about selling the nursing home, it's about selling it to our company. It's about me. So let me tell you about me. I'm 48 years old. My grandfather immigrated from Argentina, and yes, I speak Spanish fluently, and sold carpets out of his car. He worked long days and worked really, really hard. My father opened a furniture store in a very, very rough part of Brooklyn. He had to carry a gun, legal of course, because he was held up so many times. And at 45, he had to retire because of a heart condition, because of the stress of his business. And he also worked really, really hard. I went to Yeshiva University and received a BA in psychology, and went to Columbia and received a master's in healthcare administration, and I recently guest lectured there as well. At approximately 21 years old, I served as an auxiliary police officer in New York City and a volunteer EMT and paramedic for the last 25 years, and I'm still active and go on calls day and night. I responded to 9/11 and got there as the towers were coming down, barely escaping with my life. If any of you saw the movie 102 Minutes That Changed America, somehow I ended up on that video at the World Trade Center. If you want to check, I'm in towards the end of the video. I'm really not a bad guy. I really do have an innate desire to help people. I'm also a businessman. Not the best, not the worst. The New York State Department of Health thinks that I'm a good guy. They know I provide good care. You don't need to believe me, just give them a call. The federal government knows I provide good care. The local communities we are in, including Fulton County, Washington County, Steuben County, Ontario County, and Essex County, know that we provide good care. The residents and patients that we serve and continue to come back to our facilities know that we provide good care. And the 9,000 workers who work for me and Centers Healthcare know that I take good care of them as they provide good care. There is only one person or group in this country who thinks that I and Centers Healthcare don't provide good care, and they live in Warren County. I am here today to defend myself. First time I had to do that in almost 20 years. I do it with pride. Before I begin, I want to thank the board members of Warren County who had the faith in Centers Healthcare to choose us as the buyer of Westmount. The public may not know, but the board put us through the ringer before choosing us. Lots of meetings, lots of questions, and lots of work on our part to prove to the board that we were the right choice. So we're going to start. Let's begin by examining and tackling head-on some of the issues that were brought up on so many of the op-eds and opinions. The nursing home industry is very, very complicated. Nursing homes are the most highly regulated industry in America, surpassing the nuclear industry about 3 years ago. It is very easy to throw around some benchmarks used on a website and consider them the gospel. We don't consider them as such because so much goes into running a successful facility. However, we are very comfortable with and understand with much greater acuity what the numbers mean, and that someone who is not in the industry full-time may not understand. We will now go through those numbers, and hopefully you will have a greater comfort level in appreciating why Centers Healthcare is a first-class organization with great outcomes. Again, if you have any questions before, during, and after the presentation, please do not hold back. So just a quick reminder of who we are, very, very quickly. I don't want to waste time on this. We've done this a million times here already. So we have four parts to our company. We have the long-term care side, which includes, of course, the nursing homes, many of the nursing homes across the state. We do hospice, subacute, HIV care, assisted living programs, etc. On the left, that's the red color. Down on the bottom left, of course, we're a very large transportation provider. We have 180 ambulances. We provide 911 service to New York City, to the fire department. We have an accessorized contract with the federal government, etc. On the top right, we have a lot of community care that we do, home care, dialysis, urgent care, medical equipment. And on the bottom right, we're an insurance company as well. We have a Medicare plan, a FIDA plan, which is for the dual eligibles, a Medicare Part D plan for pharmacy, and a managed long-term care plan. Just again, to remind everybody, that's our footprint. The bottom is on the right side, is New Jersey. We're going to focus on the left side, which is New York State, which is where we are right now. And that shows you a location of our facilities. Some of them we consult for, and most of them we own. And we'll get to that as well down the road. Okay. A lot of things that have been circulating about misinformation, questions, why is this, I don't understand. We're going to answer all those questions today. Don't leave here until you have a satisfactory answer. We'll be here as long as it takes. Okay, surveys. You know, we throw around the issue of healthcare surveys, Department of Health, a lot, but no one really understands. So I figure we'll give you a 1-minute education on how surveys work. When the government comes in to survey you, so they give you, there's a grid. You can get a deficiency in any one of those 12 letters, A, B, C, D, E, F, G, H, I, J, K, L. You want to be in the light blue. Well, you don't want to be in all of the light blue. You want to be in the A, B, C, D, E, or F. Anything in those areas are common. Most facilities get about 7 each time they show up. Every facility in the state, there's some that get none. We have some of them as well. Some get the G's and the A and the J's. That's really bad. Even good facilities get J's and G's sometimes. It's not about getting it. Of course, you don't want to get too many of them. It's about how you respond when you get one. How are you going to fix the problems? Nobody is perfect. If anybody tells you that they are, they're lying to you. No one can have a perfect survey all the time. You want to stay in the light blue areas, avoiding the G on the third level. And it's hard to read from here, but those represent no actual harm with potential for more than minimal harm that is not immediate jeopardy. It's basically a way of saying you messed up, sometimes you left out a signature, sometimes you forgot to give a medication, but it didn't cause any harm, don't do it again. And they want to see ways that you improve yourself. That is what the survey, the health department comes in, that's what you get tagged with at the end of a survey. These are our facilities on an annual survey. These are all of our last annual surveys. And you will see the ones in green, we had 0 clinical deficiencies. We're very, very proud of those. Some of those buildings are very, very large. Some of them are small. We're proud of that. Of course, we have, some of them have 2 deficiencies, some have 1. And on the right, we're not hiding anything. You could see the level of deficiencies. Most of them are D's and E's. We had an F. We had 2 F's. Overall, we're doing a pretty good job. This is Westmount survey history. Everyone is talking about Centers Healthcare. Let's talk about Westmount. Westmount's doing a good job, by the way, a very good job. So if you look at the last 4 years, so they had 2 deficiencies in 14, 5 in 13, 9 in 13, 10 in 2011. They had 2 G's. Does that mean that Westmount is a bad facility? Who thinks Westmount's a bad facility? Who thinks Westmount's a good facility? Okay, we agree. Westmount is a good facility. They do a good job. Okay, you can't always go by the deficiencies. Sometimes you can, but in this case, Westmount really does do a good job. We have absolutely no issues with that. But if you make a mistake, you want to learn from them. Let's talk about staffing. Okay. The success of Westmount or any facility is directly related to the staff who work there. The success of any Centers Healthcare facility is directly related to the staff who work there. And I want to again thank the staff that came out from various of our facilities to show support to our company. And so I thank you very much. When we buy a facility, you should the people that are here after the meeting, we encourage everyone to apply and to stay. Without the staff that are there, we're not busing people up from the city. We're not doing that. We want people to stay, the people who know the patients, the people who know the residents, the people who know each other, to stay and work at the facility. The rates of pay and the benefits will be comparable to others in the private sector in the region. Are our benefits going to be the same as Westmount's? They will not. Say to the cameras, they will not be the same. They can't be the same. We're not a county. It will be the same, comparable to other nursing homes in the region. We don't know what that is yet, because this process started two and a half years ago, and so it's hard to make predictions and projections when things take a very, very long time. But if this process continues in the way that is beneficial to Westmount and we're able to proceed with our application to the health department, then we will start looking at those numbers sooner than later and start having conversations with the employees and having those real conversations. We're actually supposed to meet with the employees this afternoon. Okay. You know, I don't recognize your name.
Lloyd Cote.
Lloyd, you're the administrator? Okay. So Lloyd was just saying during his opening remarks that he's having trouble finding staff, and he's got to use agency, okay? He is no different at Westmount than any other facility north of New York City. There are not enough staff members to go around. We think that we're innovative in recruiting staff. But if you read the red, on average for any year during the study time period, 13% of long-term care workers said they had newly entered the field, and 21% are leaving. There's not enough staff. So we are trying to figure out ways to recruit staff. We pulled this out. These are numbers that are, this is from, we got this. This is listed on the mailing. If you can get these same numbers if you want to buy the mailing, of how many CNAs and LPNs live in the surrounding areas. So Warren County has 262 CNAs. That's not enough CNAs for this county. It's not enough. And we don't know if all those CNAs are working. We know they're licensed. They could be working somewhere else. And there's certainly not enough LPNs as well. This is not the only county that has this problem. Fulton County has the same problem. Washington County, we know for sure, does not have enough CNAs. We have 2 facilities in 1 county. We know there's not enough people to go around. The health department understands that there are staffing issues in rural counties. We speak to them about this all the time. We are very innovative in how we deal with it. So what do? First of all, we offer CNA training for free. Second of all, we build housing. We built in Fulton and Washington County housing so they can live. They don't live in the county, but they come up to live in the county, stay there, do a couple of doubles, singles, and then they go back home. And then we have sign-on retention bonuses. There is no other way. Right now you're paying a fortune in agency because you're just bringing an agency. You're doing the same thing we are. We're just doing it a little bit more innovative, a little bit more with continuity, right? We have continuity when you bring people up who work 3, 4, 5 shifts a week, 6 or 7 shifts a week, as opposed to having agency. You don't even know who's coming. That's not the right way to do it. And we could do the same thing. We could have agency. It's not the best way to run a nursing home. Who's our competition? McDonald's, Walmart, Six Flags. Okay? Six Flags, the person sits at the top of the slide with the water and just pushes people down. That's a lot easier job than working in a nursing home. It is really hard work, and it's getting harder. Walmart, we know, recently gave raises across the board. The difference between Walmart and Six Flags and McDonald's and us is that when Walmart gives a raise, they gave away $1 billion in raises to their staff this coming year. Their stock only went down a little bit, but they may raise their prices, right? Instead of charging $1.50 or $2 for a gallon of milk, they're going to charge you $2.25. People will pay it. We can't raise our prices to the residents of the nursing home. We are locked into a Medicaid reimbursement that is not going up, it's going down. So it's very difficult to compete with these other businesses. I'm going to talk about quality. Well, you know what, are there any questions so far, anything that I've said? anything that irks you, that bothers you, that irritates you, that I may not be telling you the truth, anything, now would be a good time to ask. Okay. Yes. Okay. So, I'm happy that you asked that question. I have staff members here who can answer. I haven't even spoke to them about it, but if I can ask someone from Fulton County, is there a staff member from Fulton County here? One of our staff members? Is there a staff member who can address that? Yes. Introduce yourself.
I'm Stacia Stock. I'm a 30-year employee from Fulton Healthcare. I started there when I was 19. I've lived in the county for 50 years. I've had 22 family members in that facility. I have 2 family members that reside there now. When Centers took over, we were not forced out. We were asked to stay. We were encouraged to stay. And I pride myself on last week celebrating my 30th year there. I have other coworkers here who have worked 33 years. We have a 35-year employee here. And we have over maybe 1 or 2 dozen people who have worked there over 30 years as well, and multiple that were 20. Nobody was forced out of their jobs. There was multiple talks about there. There was talks in the county about that, but it didn't happen. It was a big scare. People who hung on, stayed on, and I'm very happy. I'm very happy there, and it was a tough transition. I'm not going to lie about that. It was tough. There's a lot of difference between county and privatizing, but there's a lot of positives, and you just have to move forward with it. It's provided a good life for me and my family, and I'm very happy to have my family members there.
Thank you. So, at the end of the day, we want everyone to continue on. There may be 1 or 2 employees that have a reputation of not being such great employees, so we'll decide then not. I would say the majority, 90-95%, are asked to come back. Now, if they choose not to come back, I'll give you an example. We had a nurse who we offered more money to, but she insisted on going back to the county to work in the landfill because her benefits were tied. She had her own arrangements for her retirement, and she needed to still be with the county in the landfill, not as a nurse. You can't argue with that. You need to go for your own personal reason, but the majority of the people stayed. Now, at some point, if they want to jump back to the county because the county has better benefits, I can't compete with that. That's why it's a county. It's why it's government. But all things being equal, people stayed. People stayed. Boston? Oh, Boston Spa, yeah. Wait, Maplewood?
No, you didn't.
That's not us. That's not us. That's absolutely not us. Yeah, I've been following those newspaper articles as well. That would never be us. That would never be us. I totally understand the mistake. That is not who we are.
First of all, Kenny, my name's Supervisor Beatty, and I want to thank you right here. Kenny.
Oh.
Can I call you Kenny?
Sure.
Thank you. You can call me Doug.
Thanks.
Thanks for coming. I appreciate the effort you guys put in. You brought a large team and so forth. We were talking about Fulton, and the information I have is on the day of purchase, there's 210 employees. Immediately went to 170. And within 1 year, the facility only has 40 employees that were there when it was purchased 1 year later. So, obviously, some long-term employees stayed on board, and I'm glad to see that because consistency with the elderly is very, very important. As you know, you probably know better than anybody that if the elderly don't have consistent care, they get agitated. A lot of things start happening in a negative way. So, concerning Fulton, and I'm glad you brought that up, I know that Valley View, the county down there in Goshen, was debating on your nursing home and your ownership and some other ones, and they were using Fulton as an example of being very, very, very disconcerting, the fact that only 40 employees were there after a year after it was purchased. So I'd like you to address that, if you would, please, Kenny.
Sure, absolutely.
I can address that.
Yeah, Katie, go ahead.
When we went into Fulton, when you're saying employees, you don't know which employees in the beginning when we went in there, who was laid off, if there were layoffs at all. I was there that day. So you don't know if it's clinical or not. Typically when we go into a nursing home, there's a lot of ancillary staff. we do centralize our billing and our finance, so a lot of that staff sometimes is offered other positions, but is let go. Because we centralize it, and that's the way our business model works. With Fulton, the landfill example was, we never anticipated as many employees going back to the county. But again, we cannot compete with the benefits and the retirement of a county. So we never expected the number of employees to leave that did.
Katie, I just want to add something to it. It's an excellent question, by the way. So just as a general framework, we had 210, we left at 170. Any nursing home that's run fiscally in a sustainable fashion should have a 1-to-1 ratio. So if you're a 500-bed nursing home, you should have 500 employees. If you're 200 beds, you should have 200 employees, full-time equivalents. We should have 176 full-time equivalents. That's what we should have, and that's what we have. So if there were 210, that's why the county was losing millions of dollars a year. More people doesn't translate into better care. It just translates into more people. You have more people who don't know what to do with themselves. You don't want to have more than you need. So we started with 170 because there were layoffs. What we learned from Fulton, the advantage that Westmount is getting from having us here is that Fulton was our first county facility. It was brutal. It really was, for many reasons. One, it was our first county home. We had to learn how to deal with the CSEA, which we did. And we found for the first time ever, we learned about county rules, that people have a right to jump back to the county. Now, I don't know what the Westmount's rules are. Every county has its own rules. Can an employee leave the facility and jump back to the county within a period of a year, 2 years, within their job classification? We didn't know any of that. We are a lot smarter now. When we take over a facility now, we don't do any layoffs, period, because we know that there are going to be attrition and people who are going to go back to the county for whatever reason. Or some people may say, you know what, I'm not interested in Centers Healthcare. They're not bad people. I'm just not interested in a different way of doing things. I'm going to retire. I'm going to leave. And so a lot of people do that. It's not a typical nursing home. Counties are different than nonprofits. It's just, nonprofits kind of have the same mentality. Counties is just a different animal. And so what we learned over the last few years how to deal with that we went down to 40. I mean, is that possible? Sounds plausible. It sounds high that there's not. Is that a verified fact by who?
Well, this is coming from the head of the union down there in Fulton. So, I can give you the ARC if you like, Penny.
So he may have less union employees.
Right, there's a union and non-union.
He states on the day of purchase, the nursing home went from 210 employees to 170. What? So the day you bought it, you cut 40. Okay.
Yeah, that's true.
Okay, all right. Let me finish, please.
Yeah.
And then many other left jobs because they didn't know what type of contract they looked under the new employee. While retained employee salaries did not change, new hires were brought in at a reduced salary. LPNs went from 16.25 down to 14, so on and so forth. Employees also lost their pension plans after the switch, and you're right. You know, they were county employees, Kenny, and I agree with that. And health insurance premiums were more than doubled. Family plan went from $470 to $980 plus copay, leading the majority of workers to forsake it for a less costly one. Today, only 40 employees remain from before the facility was purchased, said Campanera. He said it was a message loud and clear that these employees would quit in Gloversville, which he called the poverty capital of the state. These are workers who have been in these positions for 20 and 25 years and had a dedication to the facility and to the patients, and they just found it unbearable to the point where they would rather quit in a city where there's no jobs to be found. So I read this, I read this, and that obviously you do the same thing as a businessman, say, wow, that's some questions.
That's some questions from a union representative.
Well,
that's true.
But he's stating how many employees are
how many employees do we have that are not
union
union?
Union employees.
Well,
not everyone is union.
First of all, I believe most, if not all, were union there. But more importantly, does it matter whether they're union or not? I mean, if you go from 210 employees down to 40 that actually want to stay there a year later, that's concerning to me. I'll be honest with you.
I have no problem with that. Excellent question. There are people who are working there who are not union, who are working on the no-frills. It's a higher rate of pay without the benefits because they don't need the benefits. Maybe their spouse has all the benefits. So we created a tier there that's non-union, that's no frills. The people working there are happy. Go ahead.
What happened too when we first were taken over in centers came in. Kenny came up and did a presentation with us and explained to everybody that he was not there to cut our wages and that we were gonna remain at our same wage. What happened is employees started running scared. Employees started talking. So employees were afraid. A lot of chatter went on, and they said they're gonna cut our wages, you're not gonna make what you make, and they got scared. And that's why a lot of them left at that time. And they left before they were counted. If they could retire, they retired and got out. If they could go find another job, they went and they found that job. In the last 12 months, especially in the last 4 or 5 months, 50% of our employees that have returned back to Fulton are people who left originally. They're people who retired. They're people who said, you're going to make less money. I don't make any less than the day that Centers took over from county. Our wages did not get cut, and I appreciate that, thank you. And nobody lost money. And what happened is it took all of them to see that after almost 3 years now we're going on, they didn't cut our wages. But unfortunately, when it was taken over, it was very upsetting that the county was selling our county nursing home. We all were county employees that lived there many years, and it was disheartening to us. So there was a lot of anger, but it wasn't towards Centers, it was towards the county in selling our facility that we've worked in all these years. So when you're gonna take it over, like Penny said, we learned. We saw that. I talked with these guys on multiple times on my opinion of that. Just have to do things a little bit differently, and don't let people make their own choices. If you keep them all, and then they can make their choice whether they want to leave later. But we have had a lot of returning people in the last 6 months.
Well, one other point I'll say to your answer, and then I think we'll move on, unless there's other questions, is what we try to do is we try to keep the wages of the people that are there today the same for tomorrow, but the new people who haven't been born yet, they get a lower wage scale. Because we know that what's being paid now is fiscally unsustainable. So we set up a second tier. People who were never made those higher rates that are beyond the normal industry standards. So we just bring it down to where the normal industry for the new people. We try to keep the old rates the way they are, to the best of our ability, within the reimbursement that our hands are tied with.
And the benefit package is, two-tiered also, or is that all the same?
Generally, it depends. It depends, the best way of answering that question. At times in certain facilities, the health contributions have remained the same. Other times, it has gone up. Vacation, the personal PTO, vacation, sick, and personal, we generally try very hard to keep that the same. A lot of times there's some movement on that, depending, because employees would rather be back a week of vacation time in order to keep their rate as is. It's really a negotiation with each individual facility. So to answer your question it really depends.
And we start that conversation, we would normally have started the conversation already, but because of all the things that are going on here, we kind of put everything on hold because we don't know where we're going to end up. But normally we come in 3-4 months before, meet with the staff, and say, this is who we are, this is our plan, this is our transition plan, this is how we're going to do it.
Okay, so the biggest part of any benefit package is the health care, as you know. So you're saying that he was not accurate when he said the family plan was $470 when suddenly went to $980 plus a copay? That's not accurate?
That seems accurate.
Okay, all right, well, thank you. So that's the biggest part. So that's a one-tier type of thing then, sir? It's not a two-type tier? You said the pay is two-tiered,
So
this is the benefit package?
we looked at the health insurance, and we recognized that there are many people who didn't have family plan. They just had single. So we try to tweak the single very little and the family a little bit more just to make ends meet. I mean, we came into a Fulton County which was losing $3-4 million a year. So we work on revenue, we also work on expenses.
Okay.
We had to do it.
No,
We're not embarrassed by it, that's the fact.
No, I understand, Kenny.
In some counties, again, you asked specifically about Fulton, but in some counties we did keep the family cost the exact same. There were very few employees that had it. For those that had it, they were grandfathered into the rate, and those that didn't have it, they had the higher.
We try to really take care of the people that are there today. Again, the yet unborn are the ones that we tinker with much more. Just to show loyalty to the people over there.
Yeah, I get it.
Go ahead.
First of all, thank you very much for being here. I want to say that we're doing a lot of catch-up here, those of us that weren't involved with the negotiations and the detailed conversations. We've uncovered a lot of information, and facts, and I really appreciate you and your team being here to answer these questions, because this is the first time that we've had that direct one-on-one with you. So, I appreciate your patience with us as we get caught up. I have some information that I've received on Fulton Center from the Center for Governmental Research. You're familiar with CGR?
They interviewed us for that. We were nice enough to offer them a free interview for their study.
Good. Good. I appreciate the cooperation. Once again, it shows your willingness to get right out in front and tackle these issues. CGR is a well-respected outfit. They are constantly asked to come and present to the NISAC group, the Association of Counties. They just most recently presented a document on nursing homes, which is very informative. We've shared some of that information at our town halls, and we received a report in that was written, and I just had a few questions about it. Are you familiar with this report?
I haven't seen it in a long time. So you can read it to me. It's fine.
I'll just
read me what's important. Sure.
From it, and then
Absolutely.
I'll be happy to hand it over. Fulton went through the traditional RFP process like we're going through. That's correct?
Yes.
So you participated in RFP. There was a comment, and I don't think you can address this, but there was a comment that said, according to some accounts, I assume they go on, they talk to a lot of people, and then they write this report. They said the process of selling the home was made more difficult by a lack of transparency on the part of some county officials. I think that makes it all the more important for this process that we address any of these questions and concerns. So I really appreciate you being here. You took over the home in April 2012. Is that correct? I just want to make sure their information is accurate, because we're basing some of our comments on it. Healthinsight.org, are they a credible?
So you're going to talk about the Medicare scores, right? So we have, that's a whole section that we have coming up. So
okay.
Can we just do the presentation and then you can ask the question? Because it might answer some of your questions. We are directly answering your question.
Yeah.
We think in our presentation. If we didn't, then ask the question.
All right.
On that.
We've got a chart, so I can come back.
Yes, absolutely.
I just wanted to verify that you took over in April.
Yes. Yes, we have
2012.
purchased, since Fulton County, we've purchased quite a number of other county homes that have gone smoother than Fulton. Fulton was our first. When iPhone came out with the first iPhone, it's just not as nice and acting as well as the new iPhone 6 Plus.
Mm-hmm.
We learned how to do it.
This gets back to some of what Mr. Beatty said. The report said shortly into the transition, staff began to feel that promises weren't being kept. Do you care to?
I mean, the staff are here. They know better than, I mean, I'm not involved in every single, conversation that goes on, but the staff from Fulton are here, and I'm happy to bring them, and I would bring Washington's staff in Essex County and Ontario County and Steuben County, and they can also address how I didn't even know they were going to come and speak. I knew there were people coming. I very much appreciate that you came. Let them answer the question, because I don't know. Let them if we were transparent or not.
Okay.
Promises from the county or promises from?
Shortly into the transition, staff began to feel that promises weren't being kept. The lower overall number of staff meant that everyone had to do more work. The change centers maintained was justified. The former county home administrator acknowledged that as a county home, Fulton probably had more nurses than needed, but the changes were difficult for staff to adjust to. Also, benefit cuts took hold as employees had to pay for more of their health insurance, and new retirement plans were introduced. That all adds
it's
up
all
to
true.
What you said.
Everything you just said is absolutely true, and we're proud of it.
Yep.
There were too many staff members, and the administrator himself agreed, and so we come in and do the things that need to be done.
Right, and I'm just reading a report that I read that said that there were staff that felt the promises were kept.
I'm not sure who,
No.
certainly not by us. I can't speak about the county.
You have to understand
Did we keep our promises?
It's a report from a legitimate group.
But who didn't keep their promises?
Just
And who they interview?
response, that's all.
Okay.
So,
And one of the reasons that we were short was because of the staff that chose to leave on their own accord. A lot of them got scared because they heard about private takeovers, and they really had never been involved with them. In Polk County, we'd never even heard of that. So it was new to all of us. It was say that I'm happy through the whole process. I was not. There were a couple days I thought, what am I doing? I need to get out. But I have, and I think we all do, our devotion to our county and to our residents. And the only way we can make it better for them is if we made it a better transition. And the staff that left put us so that we did, because I was a CNA when this process took over. I was a CNA on the force for 28 years. So I had to do extra work. I had to do extra things. But it wasn't because centers cut the amount of employees that we had. It was because our county staff chose to leave and go to other jobs. Some were happy to take unemployment. They wanted unemployment. Oh, I'm going to take advantage of taking unemployment. We lived that.
Okay, you've addressed it.
And some have returned because they hear our stories and say, oh my gosh, you're still at center? I'm at center and I'm very happy. Was it all, you know, it's work. But
It's like a marriage. The first year is the hardest.
Yeah, thank you. All right. Next point they made was, centers began admitting different types of residents to keep the homes full. Under county management, the home was often not full, with as many as 30 beds empty. Centers began targeting not only short-term rehabilitation patients, but also bringing in residents from out of the area, some of whom had severe behavioral or mental health issues than staff was used to seeing. Is this something that is accurate, and if so, can you address it?
So I'll address some of it that I can remember. The other folks could hopefully, close the gaps that are missing. When we took over the nursing home, there were 60, how many empty beds? 40 empty beds out of 176. That's unsustainable. That means that we'd be bankrupt. We'd have to close down, and we didn't want to do that. So we did bring as many patients as we could from the area. Again, Gloversville is a very rural town, and we just needed to bring patients in that nothing that we were not able to handle. The census is stabilized. I think we're running a 98% occupancy now, and so I don't think there's any issues. I mean, yes, some patients have behavior issues, but that's okay. That's what we're here for. I mean, there are patients in Gloversville who have behavior issues, and so we take them to the nursing home. And we'll go through some of the things that we're able to do that other facilities are not able to handle. If I were to ask your administrator, can you handle an HIV patient? Can you handle a neuropsych patient? Can you handle a dialysis in-house patient? Can you do a vent? These are things that we do. We do it all the time. We are experts at it. Westmount can't do that today. If we buy Westmount, we will elevate the level of clinical services that are offered there for sure. For sure.
Their next comment was on the impact. The changes in the resident population drawing more from outside the area, including New York City, has changed the climate of the home for the worse, according to some. So, based on what you said, is this just a byproduct of the fact that there weren't enough residents locally to fill the beds, and you're doing whatever you have to do to fill them, including bringing in people from outside the area?
So we needed to stabilize. Right now we have an excellent relationship with the local hospitals in Albany and the surrounding areas, and now we're getting the patients. We've proven ourselves that we provide a good quality product, and now we're getting patients from the area. We just had to get over that hump. It was a decision. We never took a patient we couldn't handle, but yes.
One thing I want to add also, being a 50-year resident of Fulton County, one of the things that happened is, just like we had with the staff who wanted to leave, we had people in our community, and I come from a family very well known in the county. It went out in the county that things were bad. It was not a good place to come. So we had a whole reputation that we had to deal with. So now they're putting the elderly in nearby nursing homes, and they were avoiding census. They really were. But I work with admissions now, and recently we have gotten some major patients who live in Fulton County, and they're coming back. I talked to a family member on the phone that I've known my whole life who had an issue. I dealt with it immediately, and she felt that hometown feel. We are getting back to that, but it's taken some time, and it took some time because the people who were unhappy as far as employees went back to the community and gave us negative press. So we're working on getting that back in. But we recently, I had a card that I just Xeroxed for our administrator, had a patient who was doing a lateral transfer to a nursing home in our town. Only because her family member lived that much closer. She described our care and how wonderful she was and how scared she was of having this relative in our facility because of what she heard. I think that speaks volumes. We've worked hard at that, and it's been an uphill battle. And we are leveling out. And as far as the types of care, we are getting more difficult patients that I've ever seen, and I think that all of us that have worked here over the years. But they educate us, they have in-services, they teach us how to deal with them, and I think we're going in the right direction. Myself, I was frightened when I saw some, but you know what? They all need a place to go, and we're taking care of them, and they taught us how to take care of them. So I feel that it was the press and the people were angry. This had been a county facility for all of these years. The public was angry. It took a very long time to get that back, and I think we're working in that direction. And I myself see that it moving forward, and the people finally understanding that, and we are getting a lot more local people than we have in the last couple of years. And I'm proud of that.
Great, thank you. One last comment about this report. Remind you that these are not my words. These are the words from a report of a third-party respected research organization. So I'm just sharing those with you to get your comments, and I appreciate them. The last thing I'll note in here, and we'll get to the healthinsight.org numbers, they comment that there are also concerns about the quality of care. In 2007, Fulton was in the 51st percentile in the National Health Insight rankings. This fell to 40th by 2011 and dropped to the 2nd percentile in 2012. That was the year that you picked up the organization, so it would be good to take a look at how those have done since that time period when we get to that chart.
Absolutely, we've done great. We took over a facility, even though they're here, but I will say that the care there was certainly lacking. Not because of the staff, but because the county did not have the resources to properly educate the staff and how to take care of the residents. It was a rough go there clinically. We had to really, literally turn things on their head, and we did. And now the most recent survey was not bad. We have a ways to go. Fulton was a rough place. But some of our other county facilities are also doing very well. So we'll get to that.
Well, one final comment I'll make is why Fulton is such a big deal is because our county supervisors and county administrator went and toured the facilities. So we wanted to see if there was, other than a visual tour, some backup data to look at. And that's why we're bringing it up today. That's why we single.
If you needed a reason to say that Centers Healthcare does a great job, it's easy to take a good facility like Westmount and make it just a little bit better. It's hard to take a facility like Fulton and make it what it is today. I mean, we're very proud, and the staff is a major part of it. These are the highlights of the study. You want to just go through it quickly? Oh, she has a question. You know what? Let's get to some of the questions. Okay, go ahead. Yeah, sure.
What are the staffing numbers now at Westmount? And what would you project those staffing levels would be?
What are your staffing levels at Westmount?
Basically on day shift for CNAs, it's 5.
5 to?
40, 2 40-bed units.
Okay.
And evenings we run 5, and nights is 2. Nurses, there's 2 LPNs days, 2 evenings, 1 night. You have the RN nurse manager on days, Monday through Friday. And then off shift, we have a RN supervisor, obviously.
Okay, so you have 1 to 8, 1 CNA to 8 residents on the day shift?
Basically, yes.
Okay, so in our facilities, depends, again, it's hard to say because we don't know what kind of care is going on there. I'm good care, I know, but what kind of, are the residents sicker? Are they healthier? We have some facilities that we have more staffing than that, and we have some facilities that are 1 to 10. So we have some 1 to 6, 1 to 7, 1 to 8, up to 1 to 10, maybe even 1 to 11, although that's rare. If we would look at your number of what Westmount's case mix is, you know your case mix?
Right now, it's
right now.
1.01.
1.01, and the state average is 1.04. So right now, you're providing care that's below a nursing home level on the state average. So really, you're not really running a nursing home. We know that you're running a nursing home. We know. You're just not capturing correctly. So based upon your numbers, you have too much staff. Based upon those numbers, but those aren't the real numbers. When we come in, and we'll get to this also, when we come in, your numbers will go up. because you're not capturing correctly. Because no one has educated Westmount on how to capture correctly. But that's what we're really good at. And Katie, we'll talk about that when we get to those slides. Excellent question. Did I answer your question?
Yeah, I'll have to listen further to.
Okay, I'm saying is that you're at 1 to 8. If you would ask me today, you should be at 1 to 10.
What about if it's 1 to 22?
Where is it? In the day shift? That's not a nursing home. That's an adult home. That's a shelter. But that's not what we do. That's not us. Where?
Washington Center.
No way.
You have people, sometimes on the weekends that don't bother to show up for their jobs, and you've got one person do it 22.
Okay.
And that hurts the people that are there, that's the problem. There's people here from Washington Center, yes, I know. My husband was there with a broken back, I saw a lot, and it's just not fair to the people that are there.
Okay.
I realize that there's not a lot of people that wanna work, and there are a lot of people that they bring in. I saw them bring in people from these agencies. They were there for 2 hours and said, I'm not doing this, and they walk out the door. How do you help people with something like that? Is there anything that you guys, after you guys go back and do a reference or reaching out and say, okay, how are things going?
Of course.
How do we have a staff?
Of course we do.
Whatever. Do you do
Absolutely. That is what we do. That's our business, to run good facilities. So, again, the 1 to 22, I don't know which shift it happened. It could have happened one time. Did we schedule appropriately? Absolutely. We usually schedule more than we need because we know people are going to call out. We just took over the facility. We're starting to have these innovative ideas of building houses on the property so that people can come up and they're committed to the facility. Yes, there are these transition issues, and once in a while people call out sick, just like in any other business, so people run short. Is that a standard? No way. That is absolutely not. We don't run once, we never get past the health department with that. Never. We couldn't provide good care. Once in a while, at night, maybe. And I do apologize for that, but that's not who we are. We don't staff like that. You can come into the building anytime and say, I want to see your staffing budget and your staffing schedule. You will see the right amount. You're welcome to come in anytime unannounced.
Penny?
Yes.
I was there that weekend. I'm the administrator at Washington Center. We did have a weekend where we were scheduled appropriately. We had a couple people that called off. So on one unit, we had 2 CNAs during the day shift. So I myself came in that weekend and I called in a bunch of our nurse managers and we handled it. So, yes, people called off and it was unfortunate and that I can't do anything about, but I do hold more staff. So I would not leave it at 1 to 22. Would not.
I know, I realize that, but I was there helping the one nurse that was passing out drugs, do the water and the ice for the people that were there, because she just couldn't do it. On one other row, there was a woman who put a client in the bathroom, and he was there for an hour and a half because she forgot it. Because there was only one person there. They just can't do everything. And I was there all day, so that I could try and help, and I didn't see much help come in until maybe after I left. I don't know. I'm just saying, you people need more help than some of the ones that you're getting from these so-called agencies. They just don't do anything. They don't want to. And I'm just afraid that this is what's going to happen to more places. Because you guys can't be there all the time. You just can't. And you don't know what goes on. And that hurts.
That is
It's not hurting us, it's hurting the people that are there.
That is absolutely correct. It's an exception, not the rule. We just took over Washington. Once we stabilize it, we are not going to have these issues. But again, it's the same problem. People who are calling out, people who left back to the county, there aren't enough staff. It's not just Washington's problem. It's every nursing home's problem. You happen to have been there. You saw it, and thank you for your help. Do you want a job? Because we'll train you as a CNA for free. For free. Yes.
Miss, can we please just get your,
What's your name? Just so he wants your name. Carolyn Brown.
Carolyn, okay.
So-
Again, for those who would like to choose to speak, please state your name for the record.
So let me just answer, I just want to answer. Just, you're probably right. Everything that you said is true. We saw the deficiencies. It goes to those scores that we spoke about. It's terrible what happened, and I wish that we could have done something to make it better. We're not perfect. I'm sure if I asked the administrator here, are you perfect?
No way.
Not you personally. I'm sure personally you are, but the facility you are. I'm sorry for that, and it shows that we have work to do. So we take the deficiencies from the health department. They were rated a D and an E. I remember seeing them. I looked at them recently, and we have work to do. We have work to improve ourselves. We will, and we'll take that. And I apologize for that mistake. That is not a general rule of how we do things, but once in a while things go wrong, and I'm sorry that it happened to you. I wish that the 100 other people who had good outcomes would have been here also, but I understand that usually the people who have a complaint come, and that's fine. But that's human nature. I'm sorry. I do apologize. Yes. Oh. Oh. Is there a mic over there?
They can come right up to the podium.
Okay.
Yeah, but this lady right here would like,
Yes. You want to ask? You want to say something?
she was just asking for a microphone.
Oh.
She just wanted,
You want a microphone? Or she just wants to pass around a microphone?
oh, okay.
We don't have one to pass. Yes. Just speak up so they can hear.
My name is Sherry McCabe, I'm from Queensbury. I have a letter from Irene Weissenhofer in regards to her mom, who was a resident in your nursing home in Fulton County, and I'm hoping that you ladies can address this concern that she has. I'm gonna move over here because I can't see.
What was her last name again?
The woman who wrote the letter, Irene Weissenhofer. Her mom's name is Mary Alice Bolston. Do you have a light you can flick on at my eyesight? She wrote really small. Appreciate it. Thank you. Thank you. Okay. This is what she wrote. The sale of West Mountain Nursing Home is very close and dear to my heart, and my mother, Mary Alice Bolston, is a current resident, required 24/7-hour nursing care. It took me a long and hard 2 years to get my mom transferred locally, and in October 2014, she was admitted to West Mount from Fulton Center. While my mom was in Fulton Center, my family and I constantly worried and suffered terribly, knowing we couldn't get to her quickly, nor was she getting the proper care. Mary has diet restrictions due to which Fulton Center continues to not follow doctor orders by giving her nuts, raw cabbage, and seeds. This causes Mom unnecessary stomach pain, bloating, bowel problems, and then she won't eat. Fulton Center is supposed to assist with all meals and take my mom to the dining room in a wheelchair for all meals. This is to keep her social and for safety reasons above all. I have been there on multiple occasions when Fulton Center staff would just drop the meal tray in my mother's room and immediately walk away. Mary does not have the ability to even pull herself up to the bed table or lock her chair in place. My mom cannot cut anything, open anything, or put condiments on anything. Mom requires assistance, even being fed. My mom was constantly losing weight at Fulton Center, and they wanted to put a feeding tube in her. Maybe weight loss also was caused by the horrible, non-quality food or the basic lack of care. Of course, I would not approve of a feeding tube. One thing my mom loves to do is eat. Mary deserves respect and dignity. She's my mom. Mom suffers from Alzheimer's, dementia, Sundowner's disease, and has lost the use of her legs completely. Mary is never to be left alone while eating or toileting. Well, I can't begin to count how many times weekly or sometimes daily I would get a call from Fulton Center informing me of my mom being left alone in the bathroom, and she took a fall. Leaving Mary alone in the bathroom was against the law. This is a form of abuse. We were blessed that she didn't break her head open or break a hip.
Many, many times I've received calls from Fulton Center telling me of medication mistakes. I took care of my mom for years prior and know what negative effects missed, incorrect, or late doses of medication can do. With a dementia patient, you must stay on top of their meds for everyone's comfort. I've been at Fulton Center during medication dispensing and seen that they are way understaffed. The staff is pulled in many different directions, redirecting their attention, causing med mistakes, in my opinion. Well, when I finally was able to get my mom transferred to Westmount, I was in shock to see her poor physical condition. Her clothes were nasty and dirty, her nails were like claws, her hair was standing on end, and she smelled. I cried. It has been 6 months since my mom has come to Westmount, and this is the result. I can see her multiple times a week and feel great about her care. They have lots of activities, music, dance, tea parties, cards, bingo, readers, games, amazing. It's bright and happy. She now smiles again. It's very well staffed, friendly, and professional. Meetings with family and staff are encouraged. She's eating very well, absolutely no falls, eats wonderful meals in the dining room with assistants surrounded by people. No medication mistakes. Always clean, fresh clothes, nails filed. They even put earrings on her, and they help her put on lipstick. That's awesome. Her room is clean and personalized. Mom's dignity and respect are back. Please don't take it away by selling Westmont to this particular group. They have a very bad history, and I know it firsthand. Our family and neighbors live in Westmount, and your family could be next. I promised my dad I would take care of my mother. Westmount is where I want my tax money to go. I'll pay more taxes if we need to. Sometimes it's not about the money, it's just about doing the right thing. Sincerely, Eileen Weissenhofer, 48 Lions Court, Queensbury, New York. And could I give you a copy?
Absolutely. Does staff at Fulton want to answer? Does anybody want to answer that? Because before you answer, is this a relative of yours?
No, it is not.
Just someone who wrote a letter. You're representing them.
Somebody just asked me.
Okay. Go ahead.
Kelly, can we have you come to the podium, please? Thank you.
I've never used one of these before, so, again, I was born in Gloversville, raised in Johnstown, and, my whole family's from the area. Now, I knew some of the stories I heard when it was the infirmary, and I've already shared that with some of the staff. My mother has been ill for several years and has been bounced from facility to facility around Johnstown and Gloversville area. Recently, when I took the tour of the facility to see what it was like, because I had reservations myself, I was very pleased and decided to place my mother in the Fulton Center. She had fallen at other facilities, had the same type of care that people here are mentioning, but I also was a CNA growing up, and I know that it's a very hard position to fill, as is the nursing piece. But what I can tell you is from the facilities that she was at over the past 2 months, we ran into the same issues everywhere you went. No place was perfect. There was lack of staff. She would sit and wait for the bathroom for 25 minutes. I would have to go get help repeatedly over and over again. She fell twice at the last facility she was at. Since she has come to Fulton Center, the amount of communication that I have seen now, they are making improvements in the involvement of the patient care advocate. Stacia was absolutely wonderful. She involved all of my family members. I come from 6 kids, and they're all very concerned about my mother. This is our mom. She's 80 years old. She's been through hell. She deserves a good life, and she deserves to be in a facility that treats her well. Again, no place is perfect, but what I have seen is some very caring staff, people that are asking her questions. Now, my mother is very temperamental, and what she was saying about the dining room piece, I go there one day and Mom wants to go to the dining room. She wants to be social. The next day she's yelling at staff she wants to stay in her room. She wants to eat by herself. She would go to put herself on the bathroom by herself when she's not supposed to. Some of that, and not to judge anyone, I see it firsthand by dealing with a patient that gets confused her altered mental state. She changes her mind all the time. She doesn't know what she wants. And the staff has been very, very patient trying to determine and get her settled to figure out what a routine would be for her. So there's a lot of other factors involved in these types of things, and I go in with a very particular eye because this is my mom. I want her treated well. I want her to eat good food. She's trying to adjust, and I can't be more thankful. I'm happy that she's there. She's improved. The doctor in the house, the physician, has helped her and weaned her off of some of her medications that were unnecessary. And she is starting to improve slowly but surely. So I just have to say from personal experience, and I do see that they're making improvements, again, but no place is perfect, and I feel comfortable having my mother there right now, and my family does as well. So, thank you.
So, we're going to move on. We're going to continue with this slide presentation, and then I'm sure we'll have more questions.
So, my name is Morty Eisenberg. I'm going to address the quality reports and the quality measures that some have brought up and some that we've seen in some of the reports that were shared. So before we talk about quality, I just wanted to share case mix index and what that is and how that has a bearing on the facility and its perceived quality. Case mix index, we refer to it in the business as CMI. CMI is an indicator of the clinical complexity and resource needs of an individual who is cared for in a skilled nursing facility. The state average is approximately 1.04, and this score basically represents the average clinical profile of a nursing home resident in New York. This takes into account all the different aspects of their care needs. Now, I'm going to share a number that I had from Westmount. I think it's an older number based on the one you just shared. The number that I had was 0.83, which at that time was below average. I see that here it's come up closer to the state average. What that means, though, is that either way, the documentation in the facility, not the actual patients, but the documentation in the facility shows or illustrates or paints a picture of a resident that did not require the same level of care as the average resident in the state in a nursing home. Every facility, every county facility specifically that we have transitioned has always been below 1, many cases below 0.9, some of them even the high 70s. Again, that really just illustrates that the patients that they are documenting care for are being given the amount of care that is necessary for somebody in, say, an assisted living facility as opposed to a nursing home. Our average is 1.2 across our homes. Our highest home is 1.42, which indicates a very high level of complexity and clinical needs in a facility. If we started consulting at Westmount today, and again, this was using the 0.83 number, but even at the 1.0 number, we would provide the education to the staff on the appropriate clinical information capture. Again, this is not the care, it's actual capturing of the care that is being rendered. Properly coding and documenting care that is being rendered in the facility as it exists right now. Without making a single staffing change or a single operational change, your CMI scores will go up to reflect the true clinical picture of your residents. And the quality scores that were shared would likely decline, just the scores, by virtue of proper documentation, even though the actual quality in the facility is the same.
So I think that's very important to understand, that if we would come into Westmount today and not touch a patient, we just tell you what we think you should do for documentation purposes only to get your case mix up and your reimbursement up, your quality score will absolutely go down. Absolutely go down. The question is why? Why do quality scores go down when your case mix goes up? So we'll tell you now. So, yeah, Katie.
Now, Steuben Center, I'm going to show you in the next slide. Steuben Center was a facility where we started consulting approximately a year before the purchase of the facility. And as you can see on some of the other graphs that Mr. Beatty had shown in his presentation, the first yellow line is kind of about when we started consulting, and the second yellow line is about when we purchased the facility. Nothing was changed in the facility. We had no ability to change staffing. We didn't change a single, at least as far as I know, there were no real changes made in the facility. However, there was an aggressive training and education to the facility on the proper capture of these clinical measures, and you can see the quality scores scores on this measure declined. Again, this is not a 5-star rating, and we'll explain that in a minute. So we feel the same thing would probably happen in any facility where we started consulting, even if we didn't make any change. Go ahead.
I just want to make sure I understand what you're saying. You're saying that the county facilities that you've been taking over, they haven't been doing it well.
Not just them, the nonprofits and some of the other places as well. That's correct. That's why they're selling.
So Lloyd doesn't know what he's doing?
You know what? Why don't you ask Lloyd?
He's right there, I am.
Well, I don't have a question, but I'm sure, Lloyd, are you an expert in case mix?
I'm not an expert, but when I took over 2 years ago, when they're 2 years this month, the case mix was .87. And we have a concerted effort to get it up to where it is now.
And what are you doing?
And this is within,
And how are you doing that?
well, we've got an MDS person who knows everything now. And we weren't capturing everything we should have.
Okay.
And that's why the case mix was as low as it was.
Okay.
We do not have a high acuity population over there.
You do not?
We do not.
Why not?
Because we haven't gotten into a strong rehab program, certain things of that nature. But we take, excellent care of who we have, obviously. But we're now capturing fairly well all the documentation we should.
Okay, so I think it's important to focus on what he just said.
Mm-hmm.
He said that the acuity of his patients are not very high. And if he feels that he's at the top where he could be. That means that you're not really running a nursing home. You're running an adult home. That's not what we do. We run or assisted living. We run nursing homes. I think you're a great guy. If we came in tomorrow, your score would be a 120. And you are running a nursing home. You just don't know how to do it because you don't have the infrastructure and the resources to train your staff the way that we do. We spend millions of dollars a year to educate our staff on how to train appropriately. And one more question for Lloyd. Who is in charge of case mix in your building?
Who's in charge of it today?
Yes.
I am.
Okay. If I were to ask your nurse, who's in charge of case mix, what would she say?
The MDS nurse?
Yes.
What's case mix?
We have gone into many facilities, and before I even walk in, I said, who's in charge of case mix? And the director of nursing turns to the MDS coordinator and says, she is. Then the MDS coordinator turns to the DNS and says, no, she is. Then they all turn to the therapist and say, she is. At the end of the day, nobody's in charge. In our facilities, there's a hierarchy, everyone knows who's in charge, and they're held accountable to it. Because if you're not capturing correctly, you're losing money.
You're leaving money.
You are losing money. Because of that. Not your fault, Lloyd. You go from 87 to 101. That's fantastic. But it's not where it needs to be. Or your patients, it's not a real nursing home. And what are you really selling? Yes.
Go ahead, Mark. I just had a quick comment. Lloyd's done a great job getting it up from 87 to 101.
That's right.
Almost the state average.
That's right.
I've looked at his quality ratings, they haven't declined.
We would have to look at the actual individual measures to see what is actually being coded. There's a lot of measures that make up CMI. They don't correlate exactly with the 5-star rating or with the Health Insights rating. The Health Insight rating is completely, I would say, very different than the 5-star rating, which has been shared, multiple times. CMS has changed it recently. Either way, they're not counting the same metrics. For example, and I'll share it in a later slide, this company, healthinsights.org, uses mood capture, depression. They use I think it's 13 long stay metrics versus CMS uses 8 long stay and 3 short stay. They're not apples to apples. They don't compare to each other. If you're looking at an individual facility, and I haven't drilled down into Westmount directly to understand what exactly makes up their CMI score, I can't answer the question. But some of our buildings with very high CMI scores is because of a therapy component. Some of them it's because they have residents that have very high ADL needs or other parts of the or ventilator or IVs. How many of the county facilities that we've taken over took an IV or started an IV in the facility? Most of them never did. We do that. That changes these scores. So, that's something to speak to with CMI as well.
Yeah,
I don't know who's going first.
Okay, I'll go first, Doug. We're both Doug, but I'll go first.
Okay.
I'm still a little confused. First of all, you make a lot of comments that you don't know about Westmount, you know about this, you don't know about that. I've been involved with a company that's purchase 11 other companies. And we would do our total due diligence whenever we purchase another company. We wouldn't be, well, I think they may do it this way, or they may do it that way, or we don't know. So that confuses me, because, you know, you guys are sharp guys. You're very intelligent.
We started 2.5 years ago.
Okay, but there's a lot of questions you can't answer about Westmount, so that, let me finish, okay, Kenny? Thank you. So that concerns me. The second thing is the CMI, and and I know you're gonna get into that, sir, and I appreciate that. Isn't that a lot of self-reporting?
No.
Let's talk about self-reporting for a second. Self-reporting is not a questionnaire at the end of the period or at the end of the year saying how many wounds did you have in your facility during this reporting period. We conduct
the Medicaid doc.
what I understand, but the way it's self-reported is not by giving a particular number to a question that's asked, like how many residents did you have with a wound in this period of time. It is actually data that is gleaned from tens of thousands of assessments that we perform over the year by many different staff members. And that is where those numbers come from. They don't come from somebody just answering a questionnaire at the end of the year. So it comes from a variety of different people and different assessment
Right,
skills.
and none of the Medicare.gov, which is, which the Department of Health uses, 2 of the 3 columns are self-reported, they are changing that now because so many nursing homes report that they do great. And you guys reported last time that you give bonuses out to your employees and they self-report and we're doing great, and that's great. I understand all that, but I don't think it gives an accurate reflection of the quality measure or the staffing reports with the both self-reported columns, sir. And that's all I'm saying.
Okay, so
And you're not the only nursing home that does it. Others do it too across.
So let's talk about that. One of the quality measures, let's say, is residents that report pain. That is a quality measure that is measured. How does a resident report pain? That means that the staff in the building or the staff in the facility needs to be asking them if they are in pain. They need to be properly documenting when they're dispensing pain medications. That is a self-reported measure. They're going around and they're saying, are you in pain? They're in tune with the resident's needs when they express that they are in pain. They then give them the medication for the pain. That actually, though, still counts as a quality measure by saying, okay, this building now has a high incidence of residents who are in pain. That doesn't mean that the quality in the building is lower. That means that we are on top of our documentation, that we are on top of anticipating our patients' needs and treating them for the needs that they have. That can be pain, that can be wounds, that can be depression, and you know, Katie can explain the mood and the ADL scores better. We could talk about ADL scores and how those are captured and some of the examples that we've seen.
But I don't know where to start at this point. Don't confuse quality measures with quality of care. You're getting them confused completely. Because quality measures are, and I could sit here all day, and I've taught for CMS, taught all over the country on this. What Morty is talking about in an assessment, you don't just walk up to a patient and say, well, you look sick, so you're a 1.01. That doesn't happen. You have a federal RAI manual, you follow their definition, and the definition that Medicare sets for everyone, statewide and federal. You fill it out based on their guidelines. Medicare clearly states that you are to provide the worst, and that is not a personal statement, the worst picture of that patient. So I, as the MDS coordinator, go, I speak to nursing, I look at the patient, I do an assessment, because the MDS coordinator is a nurse. I do my own assessment, and I am the one that tallies in an MDS, a document made by the federal government with their own rules, and I fill it out. And I hand it to New York State, and I say, here's a picture Polaroid of this patient, and here are all the services I have provided. So and they say they want the most. So when we talk about ADLs, when we talk about activities of daily living, dressing, eating, transferring, I have to get a higher score. So for transferring, and I'll put it in layman's terms, if it takes one person, that's one score. But it only has to happen twice in a 7-day period that someone needs help from a second person. That jumps the score up. So, and that's what you put on the so if someone has a fever one day, that's what I put on the MDS. Because as a clinician, I have provided more care for that patient because of the fever that one day in the whole look back. So, I mean, it gets so complicated. and to look at it at face value. It's very difficult. I have a very expensive school loan and 15 years in this industry, nursing home alone, to know that just reading, and you're getting quality care and quality measures completely. So when Morty's saying we're going to go in there and take a look at how the scoring is, just the scoring of a resident, again, based on federal guidelines, is how we score the resident. And it's not normal. For example, this is normal range of motion for Medicare. It's based on Medicare federal guidelines. This is normal. I'm a physical therapist. This is. So you guys are kind of, it's like, it takes too long to get into because there's so many levels to it. So the quality measures look worse because we're reporting the full picture. We can't treat what we don't know. So while we may have patients that are reporting pain, while we may have patients that are, and I don't like to call it depression. It's not clinical depression. It clearly states in the manual. It's not clinical depression. It's mood distress. And I'm jumping ahead here, but it's one of the most undertreated, underdiagnosed, the most treatable, and one of the biggest contributors to morbidity in the elderly. So what looks bad on paper, I think, is a victory for us because you know what? I can't treat what I don't know. We bring extensive resources in. We train our social workers. That mood distress, and we're throwing around the word depression. That's not depression. It's mood distress. Is an interview. It's a very personal question. You have to draw this person out so that they feel comfortable talking about very personal things in a population that doesn't like to talk about very personal things and hasn't, probably in a long time. Plus, new residents, moving to a nursing home is a very traumatic experience. So those patients, drawing them out and feeling that they have an open dialogue. So Medicare says that 40% of the population in a nursing home should be captured with mood distress. Our numbers are between 30 and 40%. We're exactly where Medicare says we should be. We're not higher, and we're not lower. So again, what looks bad on paper allows us to get the full clinical picture of the resident and allows us to treat.
Thank you, ma'am. That was very nice.
Yes.
I just had a quick question, Doug. I just wanted to ask really quick. If Westmont goes to 1.20, is staffing still going to be 1%?
No, it's based on acuity. Because we bring in resources. You have a clinical expert that's going to teach nurses how to take care of a trach patient, take care of a patient who's on an IV, take care of a clinically complex, so training would come in and teach it. So the population, you're opening the doors to a population that in this county is not able to go to Westmont. So now you're opening up to, because you provide the education. You have a regulation expert. You have a compliance expert. Training starts from day one. It is continually reinforced. And the experts that do the training are in the buildings on a weekly basis.
1.20 would still be a 1%.
No, that's not.
No, it's based on acuity. It's based on acuity. A 1.20 says that you're caring for very sick patients.
Right.
So you would increase your staff based on that acuity.
So it probably wouldn't be 1%.
No,
Correct.
it's based on the acuity. If you bring in a lot of patients that are dependent and need trach care, right? No, it's based on acuity.
Let me tell you something. If Centers Healthcare bought Westmount, okay, this is how it would go down. And you can quote me on this. We wouldn't do anything for 90 days. We'd offer Lloyd a job, hopefully. Hopefully he'll want to stay. Hopefully he likes us. He hasn't said anything, so that's better than not saying he doesn't like us. And then after 90 days, we'd get to know Lloyd. And then we'd say, Lloyd, we think that your budget for staffing should be X, whatever it is. Okay, and Lloyd's going to say, get together with his director of nursing and say, so what do you think of corporate's thoughts? They could say either, that's good, or seems too low, we need more staff. Then Lloyd would come down to us, or we'd come up to here and say, Lloyd, tell us why you think you need more staff. And he's going to tell us why, if he knows what he's doing. And then we'll say, you know what? You're right. That makes sense. We're going to give it to you. Or, I'm not feeling it. I don't know. But we would have that conversation. It's not just me. It would be clinical, our corporate directors of nursing, of therapy. All of us would get together in a room and say, let's understand what is special about Westmount, or what we're going to do with Westmount that it's going to require more staff. That's how it goes. That's how it goes in every one of our nursing homes. And that's how you get good outcomes, because we're all part of the process. It's not just me saying, oh, you're 1 to 10. That's not the way it works. And so in 90 days, we wait, and we see what kind of residents there are. We start scoring them the way they should be scored, and then we make those decisions. We didn't used to do it that way. We got a lot smarter over the last 3-4 years.
Thank you, Kenny. Just one other point, ma'am, just for the record, I didn't say quality, care was the same as quality measure, and I haven't equated the two. But, the reason why I put up that the quality measure report was the fact that you guys put it in your presentation last time as a shining example of how well, your facilities are doing. So, naturally, me being somewhat of an intelligent person would think, okay, if they took the time to do a couple slides on that, and it's a self-reporting issue, and when I asked, is that also bonus, you said employees get bonuses on that and so forth. So that's why I was asking that, Kenny.
And the scores that you're sharing are also, they're driven from the same data. The data is the MDS data set that's reported to CMS. The 5-star rating parses it one way, healthinsights.org parses it another way. They're still the same self-reported data sets that you're sharing. There's no difference. It's just like I said, the Health Insights chooses 13 different metrics. CMS reports a few 8 and 3 short term. Additionally, since we were here last, when we were here last, it was about, I think, 18 or 20 of our facilities had a 4 or 5-star rating on quality, and I forgot the number overall. CMS changed that very recently, and you may have seen it in the news. 30% of the facilities across the country had their ratings drop, including 30% of ours. That doesn't change the quality in the building. That means they took the bar from here and they put it here, and now we have to just catch up. And that affected everybody equally, and us not differently. Now, Westmount, it did not affect that much. Actually, I think they improved a star or two. But if you look at the actual metrics that they are capturing, such as mood, such as activities of daily living, such as antipsychotic medications and those measures, if a building is not clinically complex, they will not be affected as much as a building that is clinically complex. It's a fact. The clinically complex buildings took a much bigger hit on those 5-star ratings than buildings that are not. It's just the way it is.
The other thing I just want to mention is that we hyper-focus today. We're hyper-focusing a lot on scores, quality metrics, all that. At the end of the day, we run lots of facilities, thousands of beds. Census is near full occupancy. We have a good reputation with the health department. We have a good reputation with the staff and with the communities. So, you know, it's like saying, you know, if you go to a gas station that has the AAA seal, or at the end of the day, if you had a bad experience, you won't go back. People are coming back to us. So quality metrics are important, but it's not the beginning and end of this conversation. It should not be the beginning and end of a conversation, and certainly not a decision on whether we're a good operation. It's not. It's about what we produce, and we produce good work. Any other questions till we'll move on?
So to cover ADL coding, if you look at the ADL again as activities of daily living, if you look at the line in red, and this is from ACA's quality report, among those living in the center, in a center, for more than 12 months, 85.6% of residents need some degree of assistance with 4 or 5 ADLs. And our experience, and Katie does the training on this, I think she can talk to some of the questions that we've asked staff members. You know, how did this person get dressed today? Oh, he got dressed by himself. Did he need any help? No, I just helped him with his belt. And things like that. And that doesn't mean that that resident is not independent. However, all this time they were being coded as independent. When we go in there and do the training for proper ADL capture, you will start seeing, obviously, the change in CMI, but that change of ADL or low ADL function is going to be carried through on the quality metrics that you shared specifically, and that will stay there forever. That's not changing because we're constantly capturing that. And
you talked
about depression, same thing. You know, it's one of the most underdiagnosed conditions, and we train. On the 5-star ratings, again, we just shared this, but if you look at the quote from CMS, which they're putting on their website, many nursing homes will see lower quality measure rating as a result of these changes, even though the underlying QM data, quality measures data, may not have changed. Because of these changes, it is not appropriate to compare facilities' quality measure ratings that appear in February with those that appeared in earlier months, and that's specifically related to the changes in the 5-star rating. Again, I covered this already, but Health Insight and 5-star are not the same measures. But more importantly, the fact that we score low on some measures mean that we identify those problems, not that care is poor. Lower scores do not mean we do not treat properly. On the contrary, as an example, as I shared before, every pain medication administration needs to be documented as a report of pain. That is going to stay on our quality measure as a high incidence of reported pain. And actually, when we see those numbers go up, that means our nurses are doing a good job of identifying and treating pain. Further, we accept many patients that would otherwise not be admitted due to complex medical needs. This will bring down our scores as well. If a facility doesn't take a wound vac, for example, which is a very complex piece of equipment for a very sick patient with a gaping wound that is not healing traditionally, that patient is coming to us with wounds. That patient will have wounds until that's healed. Those are going to count on our quality scores as what they're trying to say is poor quality. That's not poor quality. We're actually turning them around and healing those wounds, but those are going to show up there. Same thing when we take residents from the hospital on IV medications. And some of the, on the one side you have the IV fluids, antibiotics, non-invasive vents, wound vacs. These are specialties that most facilities that we take over can take.
Lloyd, I just want to ask you, do you take any of those?
We don't do IVs in the building.
Okay, so is there anything on that list that you can do here?
Well, we've done a wound vac.
Mm-hmm.
Let's see, how is,
this is not a bad thing about you.
Anybody going out for dialysis
Okay.
at this time?
I'm talking about dialysis in-house. We do all this in the building. Okay.
Even going out for dialysis, those are very, very sick patients. When we do their MDS ratings, they are going to score clinically low, and they will give the same impression with a low clinical score because of all their needs and all their documented.
So just as an example, neurobehavior, okay? Does anybody know what neurobehavior is? Anybody? No, okay, close. Actually, you're not. You know what? 30 years ago, they probably would have done that, although it's coming back, I heard.
You volunteering, Tom?
Right. We do it to the staff that don't behave, not in Fulton. So neurobehavior, we have neurobehavior will never be in Warren County in Westmont, never. There's only 4 in the state. We have 72 beds in Staten Island, and the other 3 units are 15. One is in Liberty, one is near Buffalo. Nothing near here. There are 72 patients who are about 30 years old, between 20 and 40. They're either homicidal, suicidal, sexual predators, etc. They're locked in the unit. They're not allowed out unless they're escorted, and the CNAs that work there are takedown specialists. Means they're allowed to tackle the patient when he gets violent within certain guidelines. Okay, we have that in one place, largest in the state. The same people that train us, to train the staff to handle those patients, are the same people who have the knowledge to train you to handle all those other things. So if we would end up here in Westmount, we would start IVs, IV antibiotics, wound vac, all the things, and dialysis, all these things that you should be doing that right now you're not able to do because you don't have the skill set. And you don't have the skill set and resource, not because Lloyd's a bad person, it's because he doesn't have Katie. He doesn't have Katie's team to come and educate. She's an educator for 15, 20 years. We're experts at this. And so we're able to take that expertise and bring it across the spectrum. And so we'll never teach you to do HIV care. That's not going to happen here. But we'll teach you how to take care of more complex residents that may not be able to go here or Fort Hudson, but they'd have to go out of the county.
Aside from just being able to take these residents, this is the right thing to do. When a resident is in a facility and develops a pneumonia, traditionally, and this is a problem across the country, is they would go back to the hospital. And when they go back to the hospital, as I like to say when I speak, the hospital is no place for sick people. IV antibiotics is something that we can and should handle in a nursing home, and we do it well in many nursing homes. Same thing with IV fluids. Somebody's getting a little dehydrated or whatever it may be. If we can get ahead of that, we save them a hospitalization. And basically, almost all of the other measures that are on there, TPN is a very complex need. Dialysis patients are very complex. Heart failure patients are complex. We are able to take those, but again, those will reflect in our scores across any facility that we operate.
Yeah. Could I ask about psychotropic drugs?
Sure.
I'm going to bring up a painful situation for you. I'm sure you're very saddened by the death that happened at University, your facility. And the New York Times wrote a piece about it, and I just feel an obligation to mention it and bring it up. There are bad things that happen out there, and you can't control every single situation. But the part of this article that I wanted to talk to you about wasn't the death that occurred and how it occurred, which was tragic and unfortunate. But it had to do with the use of psychotropic drugs. And I know you're very familiar with the Long-Term Care Community Coalition and Mr. Mollett. And in this article, he, quote-unquote, said, when there's not enough staff, it puts enormous pressure on the staff that are there. And the reality is the facility has the potential to become a hotbed of neglect, if not abuse. Just his comment. And he went on to further say that the owner has a reputation of coming into facilities and reducing staff. We talked about that. But the thing that I want to get to here is that Mr. Mollett, the most alarming state statistic is that 45% of the home's residents were placed on psychotropic drugs there for the first time, more than double the national average. He says this is a marker of poor care. Do you care to comment?
He's saying at university?
Yes.
No, I don't need to read it. I read it. The situation was an awful situation. But to say what, you don't know what the staffing level was at university.
No, he just wants to know that we have 45% psychotropic drug use there, and that's a marker of poor care.
Yes. I don't believe it. I believe it's a marker of care. As we were talking about with what we don't know, we can't treat. So while any resident coming in, excuse me, any resident coming in getting new med for the first time, who's to say that they hadn't been needed for years and years prior to? So the clinical picture that we're able to get on a patient, I mean, overall in our organization, we've decreased antipsychotics by 30%. And that's a focus of ours. So to say that, I mean, I don't know those statistics, but to say that they've been put on for the first time, I mean, putting it under a massive umbrella, and what I'm saying is we get the full clinical picture of the patient, and therefore we treat what we see. So I stand behind.
Just a comment.
Can I just answer one more thing?
Yeah, please, Jerry. Go ahead.
So let's talk about University Nursing Home, because it was in the papers. If anybody wants an autographed copy of that, of the Times article, I'm happy to give it to you. Tragic as it was unfair. So this is what happened, and this is the press release that we had on December of 14, just a couple months ago. A long-standing employee of university. That employee was there for over 14 years. Got into a tussle with a resident, and the resident died because of an accident that happened when the resident fell. This is an employee of 14 years. We haven't changed staffing in university since I bought it in 1999, 2000, in almost 15 years. 2001, we haven't changed the staffing. It's 46 beds, 46 residents. This is one of the most stable nursing homes in the state of New York. Somebody went postal, snapped, and ended up, resident died. Tragic, really tragic. She was arrested by the police, Attorney General, and everyone is calling me saying, Kenny, what kind of a nursing home do you have here? How could that be? And I said, I know that we didn't do anything wrong. I know it. But the only one who's going to vindicate me is the health department. So happens to be, we happened to get in the mail. I guess they must have, the gods were shining, that we got this letter last week. Right here. I can't see from there.
So this is a letter from the Department of Health, and the part that's bolded is, at the conclusion of this investigation, it was determined that there was sufficient evidence to refer the case to our Division of Legal Affairs for additional action with the accused individual. In addition, there has been no culpability attached to the facility in this case.
That's from the Attorney General and the Health Department. The facility didn't do anything wrong. It was a tragic situation. An employee snapped and killed and basically caused the death of a resident. So there'll be plenty of lawsuits there. But as a facility, we stand by our care. There was nothing wrong.
So just
With
addressing,
One second, with regard to the New York Times article, okay, there were quite a few facts that were put in that article that in general were completely off base and irrelevant. Number one, the expert that was cited, if you go to his website, you can actually, I went there the next day and said, how do I join this wonderful organization? If he's a nursing home watchdog, I'd like to be a part of that. Well, it's not open to the industry. It's only open to him and whoever it is that is on the outside, so I don't know what he's actually trying to do with affecting care in the nursing homes. That's number one. Number two, we were called actually the day before the article went to print, and we were given a list of questions. It was very, very apparent that this was going to be a hit piece by the New York Times. It had nothing to do with centers. It was something that this particular reporter was doing with regard to nursing homes as a whole. So we didn't answer the questions that were given. She brought up staffing cuts, and one of the articles that she quoted liberally was from Cranes, talking about how we took over a nursing home that was 500 in beds, and we laid off 500 employees at the closing. Now, it defies logic to buy a nursing home and lay off 500 employees. What actually happened there was, at the stroke of midnight, 500 employees were laid off. At the next second, they were rehired by Borough Park Center. So she quoted that as a fact that this indicates that we lay off staff. The next one she quoted was from the Staten Island Advance, talking about how we went and laid off 55 of the 60 nurses in the building. Again, defies all logic. And if you actually look at the story and you look at what happened there, we made changes to some of the staff over the time after we took over there. The RNs, they had all RNs on staff there. They were replaced by LPNs. The LPNs that took those jobs were doing jobs that were at their scope of practice. The RNs that were working in the building, the 60 RNs, were practicing way above their scope of practice and weren't necessary. So that is what happened here. So if you look through just about every single quote that she quoted in that article in the New York Times was problematic. And then to quote this expert to say that the reason why this particular staff member was there for 14 years killed somebody was because she was understaffed, a little bit far-fetched.
thank you. My follow-up was, if I'm to recap what I'm hearing, if you get a bad rating, that's actually a good thing. And if there's more drugs that are prescribed, that's a good, than twice the national average, that's a good thing too. I just want to be.
I don't know that we have stats that say
I
that.
just want to be clear. Is that correct?
Where did we say twice the national average?
Mr.
This gentleman quoted us as being twice an hour.
So that quote wasn't correct.
I don't know if it's correct. It doesn't sound correct. What I do know is that there has been a challenge by the American Healthcare Association for nursing homes to reduce antipsychotic use, and we've stepped up to that, and we've so far reduced by about 30%. I don't know what the number that's reported in there, but based on the rest of that article, I have a hard time believing any of the numbers that are in that article. Either way, it's something that we're on and something that we're on top of.
I'm not even familiar with that article, to be honest with you. That was the, but, so, you're saying that who put that article out, Mark?
It's New York Times.
It's the New York Times, that information is incorrect.
The article was written by a political correspondent, not by a healthcare correspondent. So I mean, we follow the Times. We follow how this same correspondent has issues with the Department of Health, federal government. They're the ones who highlighted the whole Medicare score issue, and that's because of that the government, revised the score. That's that same person, if I'm not mistaken.
Okay. So one other question, Kenny. So you would know what the national average would be, correct? That would be a fair assumption?
That
question? That the
what?
national average for prescribing those?
I can say the answer. No, actually I don't.
You wouldn't know
I
that.
can quote you 5 different national averages, and if you go online, you'll find the same. Depending on who you ask, just like you see with the CMS 5-star and the Health Insight, you can have a facility that has a 5-star rating on CMS 5-star has a 0 percentile on the ratings that you share. One of the biggest challenges that we have as an industry is there isn't a straight metric for almost any of these measures. You go to ACA is telling us to reduce it. We are.
Okay, so we don't know then. No one knows.
What
the average is. The federal. Wow, that's very concerning.
We compare our facilities to each other. We compare them to. We have software that actually prints the local and state and national averages next to each facility as we print them, and we challenge the facilities to beat them, to beat those averages. And now, especially with psychotropic meds, that is a new focus, and it's been a focus now for about a year.
The industry doesn't have an average. The industry doesn't have an average, is what we're
But the
saying.
federal government doesn't track that. You're telling me that
They
there's no...
track it per facility, but they don't have an average. You can, the government, I mean, just what Morty said, there's 16 different ways to, you can go and find a number. But that's why the associations and the Department of Health and New York State and the government don't give a number and say be below this. They say reduce it. The industry, it's a flaw of the industry.
I'm not quite sure, so they do it on a home, per facility basis, but they don't do a national average or cumulative total. Would that be accurate then?
No, they share.
If one does, then it conflicts with another association or another organization's number. So
He's asking, does the government put out a national average? The CMS have a national average.
Thanks.
I do what I can.
You and I are working together.
Make me a supervisor.
Make me head of the,
Census Healthcare?
There you
We'll
go.
talk afterwards. Okay.
I'd just like to clarify, the Medicaid.gov actually says the New York State average is 17.8% for antipsychotic drugs. University Center was, this is again Medicare.gov, 50.4%. That's a 283%. It's the worst of everyone in your, of your 30 some odd ones that you are somewhat associated with. It is the worst one. It might have been, if you look at the Insight.org ratings for University Center, they took a huge drop a year before this death. It might have been, it went down to like 0% from a very good number. I mean, this is a 5-star facility. It's one of your best facilities, University Center. It took a large drop a year beforehand, and a lot of it was possibly due to this large increase in antipsychotic drugs. What I'd like to address here, though, is a statement you made earlier that based on the CMI ratio of 1.01 and Lloyd's reporting that we now have a 1 to 8 staff ratio, that it really should be 1 to 10. Well, if that were actually implemented, that would be putting a 25% additional burden on the staff. That's quite an additional burden. And while I am 100% in agreement, I don't think there's anybody better in the world at sharpening their pencils and getting these costs down, or recovering the costs from Medicaid by getting your CMI ratings up there, which increases your reimbursements. I think there's probably nobody better, in the state, maybe, in the world than that. I do, though, question why, in the case of Ontario County, why Amir here would be paying such a high rent to you. I'm taking it from the Department of Health document dated in 2013. It appears that, while you were saying that you do not own Ontario, just like you do not own Suffolk County, actually Amir does, that your name is on for Ontario Land Associates LLC. Is that true? So it says here that Daryl Hagler owns 50% of that, and Kenneth Rosenberg owns 50% of that. And it also details what the lease arrangement is between you and him. It states that you paid $1 million for that land, and that you lease that property to Amir at $400,000 a year, forever. So $1 million investment, you get back $400,000 a year. You pay back in 2.5 years, the rest of that's gravy. I mean, when you want to go ahead and sharpen a pencil and go ahead and say, we're going to double the cost, we're going to go ahead and double what these CNAs have to pay for their insurance, we're going to cut their wages from $13 an hour to $10 an hour, because that's what the other facilities do around here, and then at the same time go ahead and get $400,000 a year, in profits, on the other side. It just seems that, you're sharpening the pencils on one side and maybe not on the other. Would you comment on that?
I'm not following how my real estate transactions are relevant to any conversation. None at all. We have an issue with our weight scale. We spoke about that before. I don't own Suffolk Center. We'll talk about it in a minute. I don't own Ontario. I own the land under it, and he has an obligation to pay that money whether the facility makes it or not. So he could be writing a check while he's still in the red. So he's a bad businessman. Maybe I'm smarter than him. I don't see how any of this at all is relevant to the conversation here today. I'm sorry.
Well, I think it's relevant because you're saying how important it is to sharpen the pencil, and yet you're going ahead and drawing funds away from him, which is, maybe he could use to pay the CNAs just a little bit more and keep the people
So
there.
let me ask you this question.
Yeah.
I'll throw this right back at you. You're an engineer. I'm sure you're very successful. And if you have a plumbing problem, will you pay the plumber who charges you double, or will you pay and they both do equal job, or you pay the plumber who charges you a reasonable amount?
I do it myself. I'm an engineer.
Okay.
So thank you.
Would you do? All right. That's a silly
Mr.
answer.
Hagler and you end up getting a very large return on that investment. There are at Corning Center, you have a similar, or not you, but Mr. Hagler has a similar arrangement, which is yielding at about 90% return on money. There's others, about 12 of these different deals out there between the land associates and the operations associates, which always was a question to me why you would break that up into two pieces, but it's become a lot clearer why that is. And I'd just like to ask you, there are a couple of people that you have business associates with. One is this Daryl Hagler, but then there's Mendel Hagler as well at the Bronx Center. Are they brothers?
I just don't understand what the relevance of all this has to do with Westmount. I mean,
Well,
just if you answer, I don't mind answering them. I'm just saying, what is the purpose of that?
All right, so in the press release it says, bring your questions. There is nothing we won't answer in an
Ask me what I had for
in an
breakfast
effort
today.
to set the record straight. So, I mean,
Ask me what I had for breakfast today is just as relevant as a relationship with Daryl Hagler and Mendel Hagler. Tell me what that is relevant to this conversation. Yes.
I think, Mr. Whitehead brought this to my attention, and I asked him the same thing. I think in my mind, the relevance is how we're structuring the deal with you for the sale of Westmount. There's two pieces to it. I've read both contracts, and since you're asking, I'm going to get into this a little bit. At the February 20th meeting, I asked who was going to own Westmount, because we had this long discussion about Suffolk. So I'm looking forward to getting into that as well. And the answer was, you are going to own it. That was the response. Is that correct?
I'm going to own a majority of it.
A majority of it. Okay.
Of the Westmount operations, the nursing home, the theoretical beds.
Okay. That's where it's relevant for me, Kenny.
Sure,
is I just
absolutely.
trying to understand, because I read the contracts and your name is not in the contracts, and I was told
I'm assuming it's an LLC.
they're both LLCs.
They have to be.
There are two contracts. One is Warren Operations Association, LLC, which is being sold to that LLC. Isidore Friedenberg is named, but you weren't, so I just...
He's the attorney.
He's the attorney. $800,000 for that. And then the land is the bigger acquisition at $1.5 million. That's Warren Land Associates, LLC. Again, Isidore Friedenberg. So, I was hoping you could explain how you're the owner. You said you're going to be the majority owner, but there'll be other ownership interests. Is that correct?
Yes.
All right. So will you own the majority, like over 50%, or
Yes.
is it split up?
Yes.
Okay. And then on the land piece of it, will you also be owner of the land? Or
No.
That'll be a separate.
The issue that's germane is the health department. So what the health department looks at, they don't care who owns. Somebody in China could own the land. It's just a piece of land. Okay. It's what the nursing home, what the beds are, who's taking care of the residents. That's why I put my reputation on the line, and that's me.
Mm-hmm. Yeah, so I'm a Warren County supervisor. I care who owns the land and who owns the facility. So I do care
That's fine.
about...
Daryl Hagler will own the land.
I care about both,
No problem.
sir. And so when we get into, I think some of the confusion that lies with these arrangements that you have is they're all across the board. You're a very savvy businessman, obviously, and we're just trying to understand who we're selling to and who is coming into our community and what their involvement is. I think you answered that on the question of the two LLCs, and where it's relevant is, what I don't know is what those lease terms are gonna be going forward, and maybe that's none of my business, because once the county sells it to you, that's your business with your partners. But I think what Mr. Whitehead's getting at is, at least in the case of Ontario, the real estate's where the real money is in that deal. And if $400,000 a year is going out of that facility to real estate owners, then that's cash flow that's being pulled from the nursing home, and that could have a major impact on the residents of that nursing home and the employees. So I think that's the tie and that's the relevancy. So we want to better understand it as it relates to the sale of Westmont.
So there is the relationship that the way that Westmount would be structured is no different than would be structured, that's structured at Washington, at Fulton, at any of the other. Ontario happens to be a different situation, but it would not apply to here. And there's the health department's role is to make sure that that the care that's being provided is appropriate and good. And so they've never had a problem with us. So your concern, and I understand in theory your concern about cash flow, but we're a very well capitalized company. Cash flow will never be an issue in this facility. We don't have a cash flow issue in a 500-bed facility. We're not going to have a cash flow issue in an 80-bed facility. Does that answer your question?
I don't know if cash flow is the right term.
You tell me. So you tell me.
That was a term I used.
If it took us a year and a half or 2 years if we had to lose money for 2-3 years to get where we need to get with staffing, etc., we're absolutely prepared to do that.
But just in the case of Ontario, it just seems like a lot of capital going out of that firm, and that's just an opinion.
Okay.
So, would you answer my question? Because it is relevant, evidently, because Mr. Darrell Hagler has just now been identified as the person that's going to buy up the land underneath this. Is Darrell a brother to Mendel?
Again, I don't understand why it's relevant.
Well, because he's also a brother to a fellow named Shlomo Hagler, Judge Shlomo Hagler. Doesn't mean anything?
I'm saying, what's relevant? I mean, what's relevant about any of this? You're throwing red herrings out to cause doubt on a company that's grown over 20 years, done a good job, and you're questioning just things that are not important.
Bring your questions. There's nothing we won't answer in an effort to set the record straight. I wish that you would just tell me these three brothers who all live in Manhattan, and the Judge Shlomo Hagler happens to be an extremely close associate of Sheldon Silver. And yes.
I mean, really? Really?
Really?
This is what you've been doing over This is how you've besmirched my name for the last 2 months, and I came here to tell you that what you're doing is just wrong. I've done a good. I'm not answering any of these questions. These are not questions that should be. I didn't come here to answer those questions. I came here to answer real questions. I'm sorry.
You came here.
I mean, really?
A bunch of employees and
Do you have
answer
any
the
other
questions.
questions?
I mean, really?
Thank you.
I mean, really?
Mr. McDevitt.
Well, thank you. I thank you, Mr. Rosenberg, for coming. Okay, I actually grew up in Brooklyn, and I've got to get used to people that talk as fast as you do again.
I'm sorry. My kids talk faster than I do. I don't understand them.
Okay, the couple of issues, and the more I learn about the nursing home business, I think the less I want to know. Okay, one of the issues that I learned a couple of months ago was the lack of staffing requirements in nursing homes. The fact that we as a country, as a society, highly regulate facilities when they relate to children, but we don't have any staffing requirements as it relates to nursing homes. Our attorney corresponded with the Department of Health, and I looked at some of the emails that he did provide, and there was an email from a Michael Herron, who I suspect you probably are familiar with, and there was a comment that he had that again I found very, very interesting, and something I disagree with, and I quote: "The department does not regulate or oversee real property interest of nursing homes. Therefore, we are unable to comment on the current landowner for the facility. When we had our last meeting, I think candor and transparency are very, very important. It took us probably an hour discussing whether to show a short video or not, and it all hinged on one question: who owned the Suffolk facility? It kind of went on and on and on, and Mr. Eisenberg answered the question. The question was basically, does Kenny own the facility? Mr. Eisenberg, unequivocally, on page 9 of the minutes, said Kenny does not own the facility. Not a good answer. Not a good answer. The distinction between real property and the operating end of the business, okay? So I walked away from the meeting looking for an honest answer, and then I pick up a response from the New York State Department of Health, and I said, holy mackerel, you know, I asked that question. I thought Mr. Eisenberg gave me a good answer, but the reality is, frankly, you were right in the middle of it, okay? And I may end with one thing, okay? The economic pie and the ability to derive revenue out of the dirt upon which a facility rests, and the facility itself is not endless. If you take all of that revenue and you contribute it to the entire facility, the entire nursing home, your ability to hire staff, to meet expenses, are greatly enhanced. I strongly disagree that the state of New York has taken the position that we regulate your operation but they don't look at the economic pie in terms of dollars.
Okay. So, first of all, I appreciate the tone of your question. I really, really do. So I'm going to answer finally, and I wasn't able to be here last time, so we'll get right into Suffolk Center and the real estate. I will tell you this. I would venture to guess that if you look at the transactions that have occurred over the last 3 years, 4 years, 5 years, 98% of the transactions in terms of nursing home sales, you will find the exact same land and operation. Sometimes they're the same, sometimes they're not exactly the same. It's just a function of who the real estate person is who's going to be holding that real estate and investing the money to buy the land. It's no different than buying an apartment building and you're going to collect rent from the tenants. It's really, from a real estate perspective, it's the same thing. It's just a matter of what you're going to pay for that person to put up all that money.
This person is not suggesting that what you're doing is illegal.
It's not.
In fact, it's very legal.
Right.
Okay? I disagree. We take the most vulnerable component of our population, people that are very, very sick, and we erase from that equation dollars that can contribute to higher quality care.
Right. But
the Department of Health does not regulate the buyer of the real estate, so they regulate the amount of rent. If the rent is too high or the rent is too low, they will comment. They will make a comment. They will not allow transaction to go through if they feel that the rent is way too high.
okay, let's talk about Suffolk Center, because I know that's on everybody's mind, so we're prepared for that. When Mr. Eisenberg, who clearly is a clinical person, right? That's what he spends his whole life doing. He's a paramedic, and he watches over our clinical operations. When you ask him, do I own the building? So he knows that I don't own the nursing home beds. So he answered, I don't own the building, because for him a building is a clinical entity. But if you ask me if I own the real estate underneath that building, yes, I do. So what? I have nothing to do with the operations that Paul Constam owns Suffolk Center. We are consultants for him. When he bought the building, he didn't have enough money, He says, will you help me? We put money up for him. We get a rental. We own the real estate. He owns the nursing home. He runs the nursing home as he sees fit. We do back office billing for him. We do the marketing for him. And we do some clinical support for him. Katie goes to the building and tells him, we think you should do this. A lot of times he doesn't listen to us. And so therefore, maybe his care is not as to the level that we would want. But he's no different than any other building that we consult in. I do not own Suffolk Center. I never have. I never will. And I know there was one typo when we submitted an application to the health department 4 years ago that it was listed on there, and they missed it too. It was on it because the clerk that was writing, we do thousands and thousands of pages of applications. So they knew that I owned the real estate. They thought they put my name in the wrong column. And so Medicare picked up on it that I own it. I don't own Suffolk Center. What else can I share with you to prove that to you? I own the real estate, 50%, and Daryl Hagler owns the other 50%. What else can I show you to tell you that I don't own Suffolk Center? Whatever care goes on there, I'm not responsible for.
I understand that today, Mr. Rosenberg, okay? I wish I understood it 2 or 3 weeks ago, that we would have had the same explanation. And I understand he's a clinician, but this is what I heard, this is what I believed, and, you know, so it goes to transparency and it goes to integrity.
I think that we have been transparent and had integrity from day one. We run a very, very, very large organization, very large, close to 10,000 employees. We do the best we can. If Suffolk Center had not had a bad survey or not been on TV or whatever it is, Suffolk Center wouldn't have come up. What I would like is for people who have so many negative things to say to pull up all the surveys that we did really well on and ask me, who owns that? And the answer will be me. Unfortunately, you know, bad news gets press. Good news usually is in page 25. I'm sorry that the transparency wasn't there. It was never intentional. I was out of the country when the meeting was called. I was already, I couldn't be here. Believe me, I wanted to be here. That's what happens when you send your lackeys. They give you bad information. So he may not have a job tomorrow, but, you know.
Ken, there's been a gentleman at the podium. Do you have time for his question?
I got time.
Yeah.
I'm here all day.
Oh, thank you very much. Name is Christopher Lynch, taxpayer. And actually, I'm up here from Pelham, so I'm on your side. Not Brooklyn, but pretty damn close. Listen, a lot of us have really serious questions. I only hope you can answer every one of them. We will all walk out of here with an attaboy or an attasir, and we get to welcome you up to the community, and we all live and play nice together. That's, honestly, love these people, but I've got better things to do on my Fridays. What is disturbing me in this presentation, I'll be honest. One, everybody who has something positive to say about any of your facilities is a paid employee. There's not been one patient, mother of a patient, son or daughter of a patient that's had a single good thing to say. That's odd with 9,000 employees and God only knows how many. Okay, I am a combat vet. I got 45 years of experience with self-reporting in the VA system. We all know how that worked out. So when you come up and say, again, with this permutation of numbers, and I don't understand half of them. I'm not really that stupid, but I guess I am really stupid. And again, I'm not a professional. So you started this out saying, you know, we're not professionals, so we really just don't understand this stuff. You're probably right, and obviously you guys will understand it a lot better. But anybody who comes and tells me that we should rely on a self-reporting system, and like I say, as a vet, boy, that's disingenuous. Sorry, it is. Okay? That's a really nice presentation. I used to do that stuff professionally, man. That's just for, in a short time, since, 2 weeks? Now we got the slick, copyrighted. It's a really good one. That's okay. That doesn't bother me all that much. The only thing you said so far that I disagree with a lot, like I say, a lot of these numbers are going back and forth. You say more people doesn't equate to better service. You say more people, better paid people, probably don't. I've got a father-in-law, and we've been going downhill with him, and he's in a skilled nursing. Yeah, actually, more people do give better service. Yeah, we've had some really bad situations. I got a couple of professionals in the family, and better pay, I don't know when you compare Walmart to professional staff. I was Walmart last night. I don't want any of them working with my mother or father. Okay. My questions, and you can interrupt me. I've only got 3, and then I'm going to be out of here. I saw in the newspaper article where you mentioned 5 years commitment to be running this as a healthcare facility. Now, I give you absolute, you got to be really good at what you do. And I see the other people here with you. I believe you have cash flows and plans down to the absolute penny, nickel, dime, dollar at least. And I just wonder, where did that 5, it wasn't 4, it wasn't 6, it was 5 years. So what contingencies have you and your staff discussed? What are you looking at? What made you say 5? That's one question.
Can we take them one at a time?
Oh, sure. Oh, please do, yeah.
I think that was what was requested.
That was
They asked 5. You want 10? Well, that was, they asked for 5.
No, I
That's
just,
5. The
like
answer is, that's what the county asked for.
like I say, I'm on your side. I just hope to walk out of here, everybody's happy, you take it over, and we run a really good facility. I think that's what everybody wants, hopefully.
So the answer to your question is, that's what the county asked for.
Okay, one of the reasons everybody is so up in arms right now, are you familiar, what's the House of Representatives report just came out a couple of years ago, February 5, 2013?
Which particular?
68-page report. Well, there's only one that came out February 5th on, the bottom line of it, or my takeaway with it, Medicare, Medicaid scares the living hell out of me in New York State especially. The average compensation, and keep in mind when you're talking extra services, extra medications, or extra, we're really on top of the patient, every single one of those bills at $1. That's profit, not that, and it's probably caring for incompetency and all that. That's also a profit. But basically what they're saying is that we pay twice as much as the national average for our Medicare and Medicaid. And I believe it's 68 pages. They went up and down. Oh my God, it's like it's a slush fund for just anybody who wants to run it. There's overbilling, there's underbilling, their unions are into it. You can't fire anybody. The management is into it because they got all these little, I think where Mr. Whitehead was going with all these little cross deals. This guy's consulting for him, and this guy's selling him land, this guy's renting him the land back, and this guy's selling, and this guy's building the building, and this guy's selling him the drugs, and this guy's running the ambulances, but what's happening, the bottom line, they say in New York State, is that it's so far out of context at 2 to 1 over the national. Is that a valid report, or am I? It's scathing, but it scares. I'm not really. I don't get scared that easy, but it scared me.
What's the question?
Is it a legitimate report? Should we be damn scared of anybody coming in here working with many millions of dollars of Medicare and or Medicaid? Is the field that bad, or are they out of it?
I would say that the New York State Department of Health has been extremely picky in who they approve to run nursing homes, and they think highly of us today. Will they think highly of me tomorrow? I hope so. We have never let them down. We have provided good quality care. You can read, it's all public information. Every one of our applications has been approved. When Sandy hit, the Commissioner of Health called me on my cell phone and said, "Did you take in 500 more people than you normally do in your places from the flood zone?" They didn't call everybody. They call the people that they know do a good job. We do a good job.
Okay, that's not really.
You're asking if the Medicare slush fund or if Medicare is twice as expensive in New York? We're in New York. Everything is more expensive in New York.
Not times 2 to 1, but well, some of it is. On the price of this, I can go to 10 different sites and 10 different studies. I'm looking at the Cornell Baker real estate study on value of nursing homes. As far as they're coming, the value on this nursing home, it's on a bed basis going anywhere from $50 to $150, depending on actually how you chop it up between skilled and non-skilled. But the value of this is $5 to $12 million, plus or minus. I'm wondering a couple of things. One, if they actually, I know after 3 years it would be a pain in the butt, but if this went out to say we were 3 years ago and it went out to an open auction, would you be bidding on it? 1. 2, when you came up with an offer price, how much did the cogeneration plant figure into that? That's like, what, it's almost like $2 million drag on a buy-sell. Did that decrease your money, and would you chop that out, or do you have any plans for that?
The cogen itself is a process that's going to be ending in a couple of years. So for us, it's a small, thing that we thought of, but at the end of the day, I think in a couple of years, the cogen whole thing is done with.
That's
6 years. By the time this closes, by the time this deal finishes, right.
okay.
I may have a beard as long as your mustache.
Well, I'll have one too. Last question, it'll be a
Sure.
short one. A few weeks ago, when your other people came up, they basically identified your plan to bring us into profitability as 3 or 4 different things. In their talk or whatever it is, the formula is fairly simple. Obviously the expertise you bring into it, 1, 2, 3. The best research I have, cutting staff is another one. Cutting benefits to the core. They mentioned that there would be no retirement programs, and we work around medical benefits and things like that. How could that be good for the residents? There will be a cut. There should be. Government is government. Of course, you're going to cut some, but having a elderly father-in-law in one of these homes. More people is so much better, and more skilled people, and you get what you pay for it in Walmart or in the nursing Walmart, wherever that is, where you hire the nurses. So how can dropping salaries and dropping benefits and dropping staffing be good for us? Why can't we just do that ourselves, at least bring it to a break even, and provide a service for the taxpayer?
Are you offering to hire me as a consultant to do that?
I'll tell you, that was running through my mind like a son of a gun. I'd like to get you in there for a couple of weeks, and yeah, absolutely. Yeah, I'm not allowed to do it, but please turn around 180 degrees and talk to these gentlemen, or yes, absolutely, yes. Because I do, I disagree with a lot of the opposition. I do believe providing health care, we provide health care for criminals, we provide it for welfare mothers, professional welfare addicts, and yeah, I believe, I'll probably be in there in a few years, but I believe providing health care at some level for our seniors, which we do anyway through the programs, I believe that's part of what we should do as taxpayers.
I thank you for your comments. I'll make one, there's a question behind you. I just want to make one comment really based upon what you said, and that is the healthcare environment is changing as of right now in New York State with Medicaid. I don't know if you're following, but as of February 1st, all new patients that are going to be long-term have to join a managed care plan, which means that probably in the next 3 to 5 years, you'll be billing Medicaid very, very little. And the only chance that Westmount has, or any of our facilities has, is to be strong and powerful to negotiate with the managed care companies. Single facilities have a hard time negotiating because they have no power. They can't say, oh, well, it's just one small facility. Part of the attraction to us of this facility is in the North Country is that we have the whole line up the East Coast, Washington, Essex, etc. And so our ability to negotiate with the managed care companies for the survival of this facility will be greatly enhanced if for both Westmount and ourselves, because we're able to bring that to bear. Lloyd, do you agree with that comment? 100%. So the future is changing, and what HMOs notoriously do is they bring the prices down. So if your Medicaid rate is $150, they might turn to you and say, we'll give you $140. Now, if you're Westmount, you'll say, I don't want $140, I want $160. They say, it's okay, I'll send it to the next guy who'll take that number. We'll say, wait a second, we're much bigger than that. You want to deal with us across the state, you have to deal with us here too. So it's really almost about preserving Westmount more than anything else. Yes, any other questions? Yes, sir.
Good morning. My name is John Salvador. I'm a resident in Warren County, and I'm the 59-year husband of a woman who is currently in a neighboring nursing home. She's been there 3.5 years. I notice as I pass through the front door of this facility, they have posted the occupancy of the nursing home. And I notice over the last 3 months that the occupancy of that nursing home has fluctuated between 10 and 15% vacancy. I understand this is not unusual for neighboring nursing homes as well as our hospital. What effect will this have on your ability to continue to pay employees and finance your debt?
Okay, excellent question.
Do you observe this?
Yes, absolutely.
vacancy?
Which is why, that's my point, and you really answer to the whole point of why scale is so important. A single standalone facility cannot survive easily, if at all, in 2015 and the future. This company has relationships with the hospitals across the state, but very strongly in this side of the state, because we're large and we're able to bring those pressures to bear. We don't anticipate that we'll be at those vacancy rates. I'm assuming within 60 days of, if you choose us, again, hopefully, that we'll be full within 60 days.
Second question. I was intrigued by your land arrangement and another nursing facility. As you know, there's a petition circling in our county that could delay the transfer of this facility. Would you be interested in a similar arrangement where the county retained the ownership of the land and paid us rent for occupying that land?
Is that a sanctioned offer from the county? But I'll tell you this. Let's assume that I would, which I'm not saying that I am. I just thought I heard it for the first time. Would that give you a sense of comfort that I'm a quality provider and that you're willing to have me be in charge of the residents of Westmount?
I think so. Thank you.
Okay. Moving right along. We're almost done. Okay, so these are the facilities that Kenny Rosenberg owns a majority of, or all of. These are them. Just back to your question. I forgot your name. This, if you were to call the health department, they should verify. You're welcome to call them. This is what I have ownership interest in, and the next slide is what I do not have ownership in, but we're consultants for. Suffolk Center is there on the bottom. The top three are New Jersey.
Just a quick question, Kenny.
Yeah.
I think part of our confusion on the ownership of Suffolk, and I hate to beat a dead horse, was some of the reporting that we saw that nursinghomerrating.org, they had reports at ownership records. You're a director officer there.
What's my percentage ownership there?
It didn't say. It said you're a director officer.
Right. So let me answer that right away so that there's clarity. We do, and by the way, we've changed it since you brought it to our attention. We appreciate that you brought up the typo. We're consultants for them, and therefore we do their billing. We send out the bill to Medicare for them with just with paper push. So the person who filled it out a long, long time ago thought that since we're doing the billing, I should be listed as a direct officer. That is not the right definition of a direct officer, and we're changing that. The original paperwork was an 855A. It's a change of Medicare ownership. It was filled incorrectly. So you'll see that in some places it shows me as a 22% owner, and Paul as a 100% owner, which means it's 122%, which is not possible. And some other places it shows me as a director. We're fixing all of that. I'm not an owner, and I don't want to be an owner, and that hopefully clears up Suffolk Center.
Okay. And you know, we saw that, and then we saw that you also were the owner of the property. So when we were told that you were merely a consultant, we were quite concerned, because we weren't sure we were hearing the right thing after seeing these reports.
Have I cleared that up for you?
I just wanted you to know that that's where it was coming from, and it wasn't meant to be,
So just tell me honestly, do you still have a doubt?
well, I know that you own the land.
I do. Do you have a doubt that I own the nursing home? Do you think I still own the nursing home?
No, but I just wonder your level of involvement. It's a vested interest, I assume, because you're involved as a consultant, you own the land, and your logo is on the front awning. So maybe we were mistaken by saying we thought you were ownership based on this material, but I would
Right.
change that to say you've obviously got a vested interest in that facility.
A vested interest in the real estate, and hopefully he'll do well. And the truth is, he needs to step up his game probably, and
Wouldn't you
maybe
say
can
that,
help him with that.
Kenny, would you say though, more than just a vested, it's a strong vested interest. You own the land, you own the building, you own the consulting, or you have the consulting agreement, you have your brand on the awning. So, I mean, if we're having total transparency, it's strong.
You know what? You're 100% right, but I'm not responsible for the level of care. So yes, all that we circle, but we're not inside. And beyond, you don't know this man. You want to meet him. He does things his way, and so at some point he could say, "I don't want you to consult for me anymore. I don't want you to do my billing," and we would say, "Okay, thank you," because at the end of the day, he just has to pay his rent. That's all. Hopefully he'll continue to do that. I'm sorry? Where did he work? First of all, he may have. How is that relevant? He was a friend of mine. He needed a favor, and I did him a favor.
He has it listed that he worked from 2007 to 2011 at Centers for Health.
Maybe worked in the finance office. Yeah, whatever. Okay. Yeah, we're just going to finish up because it's late, and if there's no questions, we'll take them. Okay, these are 4 troubled facilities that have been brought up in some of the comments. So Richmond Center is the facility that has the neuropsych unit. This was the St. Vincent's bankruptcy from a couple of years ago. If you remember, the hospital closed in Manhattan. This was the nursing home connected to that bankruptcy. So we were chosen by the judge to be the stalking horse and then the buyer. 4 days after we closed, the facility was hit with multiple and serious immediate jeopardies. The health department said, "We know it's not your fault, right? I can't be responsible for something that happened 4 days after we bought it, but I need you to fix it, and I know you will." And 3 years later, which is just recently, we had a perfect survey. That was not easy to do. In Fulton, where the staff is here, we had multiple G levels, which is harm levels, right after a couple of weeks after we bought it. The facility was a struggling facility, and then we had a couple of IJs. 2 years later, 6 minor clinical deficiencies. Washington Center was in special focus while the county owned it and came out just before we purchased it. And the last survey was very, very good. And finally, Indian River, which I know has been spoken about, is now in special focus. We bought it in special focus, and the health department is counting on us to take it out of special focus, which I'm confident that we will be able to do. Okay, we spoke about Westmount. I don't know that. Let's go through the slides quickly, and that'll be the end. So again, we think that we'll do a good job at Westmount. We spoke to the board of supervisors 2 years ago. Some of the changes in Medicaid reimbursement are coming. I think that we're poised to save the facility. This was a study that was quoted from Leading Age, and the highlights are on there. Okay. I think that the bottom one kind of says it all. We are the long-term care experts. We're not perfect. We try to be as transparent as possible. We try to be as good as we can. We take advice from lots of people, from the health department, from our consumers, from our staff, and we thank you for your attention. And I'm going to take a lot of questions. The formal presentation is now over. So.
Well, that was quick.
could read it. Well, we can go, absolutely, go back, absolutely. No, absolutely. All I'm saying is that there's 3 nursing homes in the state of New York that are in special focus with the risk of closing. If you don't get out of it within a year and a half, 2 years, they shut you down. So we bought it in special focus, and hopefully we've now dedicated a QA nurse and a couple of other staff members to make sure the facility is on its way to achieving a good survey, and hopefully to remove the special focus. The special focus will be on for at least another year. Hopefully then we'll get it removed. We did not have anything to do with it being in special focus. It's probably the worst nursing home in the state of New York at this point, in terms of quality care, according to the health department. Okay. Any other questions? Yes.
My first name's Peter Kent.
Peter,
yes. First of all, thank you for your candor, okay? You're no BS, you're straight to the point, and I appreciate that, okay? Yes, the issue, I think is very important in Warren County for a couple of reasons. 20 years ago, we had a trash plant fiasco that it is estimated that it cost Warren and Washington County something on the order of $100 million. 8 or 9 years ago, the county entered into an agreement with Siemens, which you're contractually mentioned in that. Most people believe that that was a fiasco. Most people have a great deal of difficulty understanding their contract. Your contract is quite simple on the contrary. So here we sit with these 2 lingering issues that people remember, okay? So we structure a purchase agreement, and lo and behold, built within state law is the possibility of a referendum, okay? Democracy at work. People get an opportunity to make a decision in terms of what they want to do with what they would consider to be their most precious resource, and that would be their elderly population. My question to you is this: what do you think of that process? What do you think of the referendum process?
Okay. So,
Mr. Rosenberg, I think some clarification does need to be made here by our county attorney as to exactly what is up for a referendum.
Yeah, it is not the, what is up for a referendum is that the county exercised an opportunity through a RFP process to achieve certain objectives through the sale. And as Mr. Rosenberg has mentioned early on in his presentation, County Law 215-6 provides that when you're going to sell or lease property, it has to be through public advertisement to the highest bidder. The county felt that that was too restrictive a process, and as we've done before, in order to achieve certain results, the Perkins property comes to mind. The county decides to enact a local law to supersede 215-6 so that it can utilize the RFP process. The local law does not approve or disapprove the contract. What the permissive referendum is that directed question, is that should the county have gone to an RFP process, period. Not whether or not this is a good contract or a bad contract, whether or not that was the appropriate process for the county to employ. The contract with Mr. Rosenberg is contingent on the passage of that local law, the adoption of that local law. That's a contingency, that's a condition among a number of others. But I want to make sure, Supervisor, that you and the Board of Supervisors and the public is aware that that is the precise question that is the subject of the permissive referendum. That is it.
So what would be the result if people vote no on the referendum?
The county would have to, it would essentially be that the people would say at an election that we did not want you to supersede 215-6,
and we want you to go back to the beginning and perhaps go through a public advertisement to the highest bidder.
Okay, thank you. So you feel,
I'll just answer this.
yes, sir.
I'm not going to talk about, I'm not a lawyer, so just, I think the question that you might want to ask yourself is too, I started the conversation this morning with this, is should the county be in the business of nursing homes? I can't answer. I mean, I can answer from my perspective. I can't answer from your perspective. If you're losing money and you're willing to sustain those losses, you provide good care, you have a good administrator, and you see a future for Westmount under county hands, not just the way it is today, but what's happening in the industry over the next 5, 10 years, so then, you know, why not? But if you see changes in the industry and you see that the facility might lose a little bit too much money that it will tax the taxpayers, you know, so then you should think about maybe changing hands. The question is, should you sell to us or to somebody else? I hope that after today you feel that we're a quality provider. I hope that you do. I'll make one comment. There was a county that was for sale in Suffolk. It's now closed. And so I sat in front of the board members, not unlike here, and I asked them, how many of you have ever been to the nursing home? And almost none of them have, but they had a lot of opinions. I said, you know, I'll do you a favor. Do me a favor. Let's all go together. Let's make an appointment. We'll all go together to the nursing home. Let's tour it and see what you think. There's a lot of impressions. Oh, you're going to throw all the patients out. You're going to fire everybody all the time. All the things that people say that aren't true. But I said, come. So the administrator was there. And so we're sitting with the administrator, and we're sitting with some of the legislators. And I said to the administrator, let me ask you a question. In this facility, that's a county facility, are you the home of last resort? Do you take anybody? He says, what, are you crazy? We'll never do that. Then we'll lose money, and I'll be out of a job. So I turned to the legislator. I said, you know, there's a lot of misconceptions. Every single patient that would be in Westmount would be in one of our buildings. There's no such thing anymore as a home of last resort. When Medicaid is here, there's systems in place for every resident, every patient to be taken care of from a financial perspective. So the issue of the poorhouse, like Fulton County used to be known, those days are over. There's no such thing. We take more patients. We take the most critical patients in the state of New York. There's no one that we wouldn't take because, because just we own it and it's proprietary. It just doesn't, that's like it's not the way it's done anymore. Maybe 15 years ago. Certainly not now. So if you sold us Westmount, you'd be in good hands. I hope you think the same thing.
Okay, thank you.
Sir.
Just a question about the impact of the rental rate and the Medicaid rate. I assume that Medicaid was the fair market rate. And what's the impact if they determine it's not?
Then they won't approve the deal. They'll turn to you and say, they won't approve the lease, they'll say, you need to modify that lease. So, yes, sir.
Yeah, but if the vote is no and it goes to a bidding process, would you put a bid in?
Not sure how many times you can go through hell and back.
Just warm it up.
I can't, I'll be honest with you, I can't promise that I would. I don't know. This is rough. This is rough. This is 2.5 years. We bought 5 nursing homes in those 2.5 years. You know, this is a lot, it's a lot of work. So, I find, most people here are quite nice, but this is a process, and I get the government. We've been through this before, but this one's going, 9 innings and maybe more. So, I don't know.
Bottom line is, I only care about the residents,
So do we.
and I would want you to make a promise that they would be the couple of
I would invite you. I'm assuming you're just a community.
I'm a nurse, I know
Okay. So we have, every nursing home by law is obligated to have family involvement, family committees, etc. I would have no problem establishing, it's not required, establishing a community committee of people, some from this body and some from the community, people who live here, to meet once a month and share concerns with us, for a period of 5 years until you say, you know what, these guys are really good, they're doing a great job. I have no problem with that. We want the input. We're here for you. I mean, we're not embarrassed for what we do. Do we get into trouble sometimes? Yes, we do. Do we have mistakes? Yes, we do. But overall, we do a good job. We do a good job.
Ma'am, you probably weren't here the last meeting, but I do recall very vividly Supervisor Sieber, who is not here today, speaking directly to Katie and looked her straight in the eye and asked exactly what you were looking for, and it was a promise. So.
Okay, I know to hear it firsthand.
You got it. You got a promise.
I'm Sandy Simpson. I'm a citizen of Warren County.
Concerned citizen.
Matt's mother.
Uh-oh.
It's getting a little tight in here.
That's
I had
a
to
problem.
loosen it up. I appreciate your question and your wanting to have a promise. I worked since 1966 as a registered nurse. Most of those years I worked as a community mental health nurse, providing mental health services to nursing homes, adult homes, and elderly in their homes. Now I'm getting elderly, so I am concerned. And I also have had a mother who was in Indian River for several years. I was there as much as I could be with my work, at least once a week. And I felt like she had good care, but it was because I was there. I was talking with staff. I brought her food. We had lunch together. We took her out to eat. When I asked her, I said, Mom, I would love it if you would come closer to Glens Falls so I could visit you more often. She says, I'm peaceful here, I'm safe here, and I like it here, and she wouldn't move. So every nursing home has its problems. I mean, I don't care if you own it or I own it or the county owns it, because it's people work there, and people have problems. I would hope that this process would hurry up. It's getting old. And I would hope that when it's finished, that we do stay involved in some way. All our nursing homes and adult homes, there are people that don't have family. And I think that, we could do like a big brother, big sister thing and adopt a resident. I loved going to the nursing home and hearing in the next room a visitor coming and reading from Louis L'Amour, that's right, a book to this resident, and he was enthralled. He said, oh, this is great, and they would talk about their times in Luzerne and the horses. But we need to be there, not just at Christmas and Easter or Passover or whatever. We need to be there on a regular basis.
And by surprise at times, too.
Oh, yeah.
Absolutely. We have no problem. I want to tell you something. If I could just, I'm saying this with our staff here. Everyone says, make sure the residents are happy, make sure the residents are happy. You know what? We don't. We make sure that our staff is happy, because happy staff, right, make sure the residents are happy. If you treat the staff like garbage, they don't mean to, but they might be upset and the residents won't be treated as well. It is really our first concern to keep our staff happy. And if at any point in time you're not happy, you should let us know, right? We have a race coming up. We do an internal marathon, 5K, 10K. I know, I think Fulton had shown up last time, but you were there, right? And we spent the day. So we're doing it again. Actually, you're all welcome to run with us in Rockland County. And so we do things for our staff to keep the morale high. To the best of our ability, it is a hard job. Healthcare is a hard job. It is a people job. And so people sometimes have bad days. I have a bad day. You hope that it doesn't affect the residents, but people are humans. And so until you've worked and walked in the shoes of a CNA or an LPN or an RN, you can't judge them. You can't judge them. But our job is to make sure that they're happy so that the residents are happy. And I'll say one more thing, and then I'll take your comment, which is that the health department is acutely aware of the delays that are happening here. I was just there last week about another project, and they mentioned it. And so I told them, just being transparent, I told them to hold off, because our application to the health department is in. But I'm concerned that it's going to be a process for review probably in the next month or two. But I told them that there might be a referendum and that the whole thing will be for nothing. Because if you do a referendum and you choose to sell to somebody else, or it's just going to, and you don't have the law, we can't finish that contingency. So I asked them to stop processing the application until we have further guidance from you. It's just, we spent an absolute fortune already on legal fees, and the application alone cost $20,000. So if I would have realized that we would have held off on the application, we had a legal right to hold off. We figured that you'd want this, to have wanted this done quicker, so we pushed it through in 30 days. Now it's sitting at the health department, and they're going to process it. But why process it if it's going to be for nothing? So I asked them to stop. You can verify that with them. If you choose, I can just call them up and say, okay, we're back on. You won't see anything coming out of the health department on this because we asked them to stop. Yes.
Mrs. Simpson, just so you know, Matthew is a very nice little boy, and we are holding his hand through this whole process. He's been great.
Thank you, Mr. Sullivan.
He doesn't play well with others.
She agrees.
Yeah.
My name is Sarah Hussa. I'm a county resident and also have a mother-in-law who's been at Westmount for nearly 3.5 years. I think this whole process seems to me caught in a sentimental attachment to Westmount. It's always been a very lovely facility and well regarded in the county, and what's happening to medical costs and medical systems nationwide. I think the referendum that's coming up has some people who think the referendum will say, if we vote this down, overriding this process, if we vote it down, that means Westmount won't be sold. And from my sense of the supervisors, that's not a viable plan. And from Lloyd, you know, running healthcare is too complicated to do efficiently by a county anymore. You can't keep administrators and staff who can do all those things. My question would be then, if the referendum does get enough votes and does succeed in voting down the override of the process, the county can restructure the bid. Is that what they want in a bid? You know, there were questions about real estate. Could it be structured differently so that the county had the real estate and got the rent from whoever becomes the operator? I mean, I think those are real questions about where the process goes from here. I don't even know if there are 2,000 signatures, but if there are, I don't think people should be given the hope that voting for the referendum means that Westmount will not be sold. But if it is sold, could it be restructured so the county, you know, and obviously the county and the county's residents get a better return on what they have, what they own now, you know, real care. And I don't doubt that you are sincere about your care. I don't like the system capturing more, you know, it's a lousy system, but I think you're playing the game well, and your intentions aren't wrong, but I'm not sure the county's coming off as, or the elderly residents are coming out ahead on this. Thank you.
Maybe we should respond to that, so just to have that clarified.
That wasn't a question for me,
Yeah,
I don't
really
think. It was just a comment, so.
No.
If this doesn't go through, then I guess it would depend on the terms of the contract, which I think first you should address that with the county attorney, Martin.
Yeah, first and foremost, if there are enough signatures and the petition is accepted, then it would go to an election. The election would have to be scheduled, and then it gets put to the voters. If the contract, essentially the contract, if you will, it's not really the contract again, it's the process is voted down, the contingency in the contract fails, and therefore the contract fails. I believe both the contract for the land and both the contract for the asset, the nursing home itself, have these contingencies built within them. So the contracts would fail, and there would be no contract. At that point in time, and the county administration, the county board of supervisors, would then have to consider their options and as to how to proceed. And that would be at that point, I think, a fiscal financial question that I would turn over to Paul.
And I think that that's the issue here, to address the question about what could be done going forward. I think one of the things that has to be kept in mind is when we put out the request for proposals, and this is online, you can actually go to our website on Warren County and you can review how we transmitted these proposals out when we were looking for someone to buy this nursing home. And we widely circulated this. And like I say, you can go online and you can see all of the ways in which we sought to distribute these proposals. We ended up with 4 proposals. The first one was the highest one, and that one never materialized. The second one, the next highest one, was with Centers. That one did materialize into something. And the issue then becomes, okay, what do you do if this is not approved? First of all, we know we're going to lose money because we already have figured out the finances for this facility, and if this doesn't close as we planned, we know that this year we'll lose roughly $1 million, and we'll lose more next year. So all the time that's clicking by is going to cost the county taxpayers funds. The second thing is, the next problem we're going to have is, okay, what are we going to do in terms of how do we structure this? Because if the RFP process has been voted down by the taxpayers, then that means all we could possibly do is put it up for a bid. And if we put it up for a bid, then the issue becomes, okay, how much is somebody going to bid? Who's going to come and buy the facility at this point? So I think that the possible outcomes here are hard to project, first of all, but the consequences could, in fact, be very serious for Warren County and for the residents of the nursing home. So I'm very concerned. I think that the county did its due diligence. I think the county did put forth a good proposal. I think the county did do its due diligence with regard to interviewing and going through the applicants who were interested in buying the nursing home. And I really think that the county has made a good arrangement that will ensure that this nursing home continues for a long time into the future. If this process is upset, it's anybody's guess where we end up. But I can tell you this much, I know for a fact we will end up losing money.
So what I'd like to say to that is that we have been losing money, and it would be no different that we would continue to lose money on this. But what actually would be different is that we are getting more IGT and that there have been economies put in place, less agency staff and such, so we should be losing less money going forward. But you're absolutely right, we would be losing money just like we're losing money on the airport. So the one thing I take exception with, though, you said the only choice if this petition were to prevail would be to go through the public auction. That is not the case. You could go through the same local law again. There's no reason to expect that if we had identified a proper person to take this over. You know, we had talked to several not-for-profits in the past. Fort Hudson was rejected. Have no idea why. Actually, I do have some ideas why, but I'd rather not get into it. And but there are other not-for-profits in the area. St. Peter's has a presence in the area. Home of the Good Shepherd has a presence in the area. There are other people outside of the area that perhaps might have better records than here. You know, our home has gone up. We used to be 2 stars. We're now 3 stars. And I actually like to, you know, give a hand to that, a hand to Lloyd for pulling that off. At the same time that he went up to 3 stars, Washington County and Essex County went down to a single star. So, and there is nothing lower than a single star. So, you know, I think everything that's been said is true, that this would probably delay the sale, has to delay the sale. The nice thing about that is, you know, when you say we're going to lose $1 million next year, $450,000 of that is due to the cogen. Well, you know, as much as we probably ought to be just stopping payments today, even if you don't go that route, they're going to stop anyhow in 2017. I mean, we only have 2 years left on this thing, and by the time we package this together, it'd be my hope that we wouldn't need to be trying to dangle this cogen around the neck that's hurting the sale of this, and that we could, you know, find a much greater range of people to go in and bid on this and do a good job, and that we'd be able to evaluate each of those people critically, very critically. Each of them, as we have done here. Thank you.
My name is Michael McCabe. I live at 30 Orchard Drive in Queensbury. And first of all, I'd like to thank you for the presentation. It was really well done. And I don't have any doubts that you could do a good job with the nursing home. But I think that the idea is being portrayed that we need to push this thing along really quickly because we're going to be hemorrhaging money. And I don't think credit is being given to the fact that the people who work at the nursing home are local residents, and the money that they're receiving in salary is coming back to Warren County in the terms or in the expenses that they're spending at the grocery store and at the food store. So it's not all the money that we're paying them isn't a loss. This money is coming back to us under the present setup. Under the present setup, the vendors who are supplying Westmount are local vendors. So that money is coming back to Warren County. So the hemorrhage losses aren't near as great as they're being portrayed. That money is being recirculated. And I don't see a reason why the residents of Warren County shouldn't be solicited for their opinion on how this thing should proceed. Thank you for your attention.
John Danette's my name, Coach Danette, but to many of you. My wife is presently at Westmount. My wife, the love of my life, I just ran out just to be with her. Thought we had an activity, but she was snoozing instead. Anyway, I'm going to tell you the Paul Harvey part, the rest of the story. I don't think anybody in here has had the experiences that I unfortunately have had for the last 13 years when my wife was diagnosed with frontotemporal lobe dementia. She's a strong, strong woman. We have been in 7 different care facilities, some of which we were asked to leave because she didn't qualify to stay on. And fortunately, we ended up at Westmount. Westmount is the last mile for everyone, almost everyone who's there. It is this whole process, all this talk and everything about statistics and all that stuff, and money. All I hear is money. We're forgetting the real issue here is our elderly people. Every one of them in there is probably going to pass there. That's the last mile. They are all, I'm assuming, if not live in Warren County, have lived in Warren County during their lives and paid taxes. Probably a lot of them voted you guys into office. They should have a say in what happens. Not that they're capable of it, but we're capable of caring for them. And I'm here to stand to tell you, and I'm so happy I got back in time, that the Westmount Health Facility is far and away the way it's run right now. We've been there for more than a year. As I said, we've been in 7 other facilities. I've been in every nursing home facility in this whole region as a due diligence to my wife. I've seen them all. This is so much better than any of those other ones, privately owned, that we had the experience of being in. This one, the people, honestly, the workers, the aides, the nurses, the administration, goes on and on. They're absolutely, in my book, AAA, the way they are right now. Lloyd at the top and me at the bottom. But it's an obligation. Somebody mentioned, I think Mike just did, something about,
We have debts in other places. We provide services for our people. What class of people deserve more than our elderly? None. None. It's not about money. It's not about who runs it. It's about caring for those people. And I'm telling you, you go in there, and if you haven't been there, it's an amazing place. Every corner is caring healthcare. I mean, truly caring. The other places that we had the unfortunate part of being in, many of those workers there were not there for the caring. They were there for other reasons. I don't have to tell you what they are. And so were the companies that owned them. So I want to be sure that I got that out. I owe it to Lloyd. I owe it to the staff over there. I'm not going to benefit by this. My wife's going to be gone. We were diagnosed a year and a half ago with terminal length of time. And the terminal length of time has already passed. And my wife is doing great. Is it why she's in Westmount? Absolutely. She's doing fine. I don't know how much longer we have. This will all be gone by the time we leave. But you folks will be there. And you'll be in whatever situation you've created. And your parents and uncles and aunts will be there. And I just want to again repeat that it's truly a gem. It's a treasure that we own here in Warren County, sitting right in the best part of the county for us, and we're willing to give it away. Don't understand that part. To the most needed people in this world.
Supervisor Kenny.
I'd like to take this opportunity to thank Mr. Rosenberg for his time. I know it involved a lot of time here today. You're an excellent communicator. But I want you to know that you have the support of the vast majority of this board for your company buying the nursing home. The only thing I disagree with that you said in all your speeches is when you were talking about the death at the nursing home, and you said the employee went postal. Well, I'm a retired postal
Knew somebody would get me on that, and I apologize. It's just a euphemism. Okay, sorry.
And Bill,
Why do they say that about the postal workers?
Supervisor Conover?
Thank you, Mr. Chairman. I think the question was asked, and I just want to respond to it as clearly as I can. There are two basic ways we can dispose of public property. We can put it up for sale and sell it to the highest bidder, in which case you won't care who owns the land, buildings, or the air. It's just sold to the highest bidder, right? That's how it's disposed of. The reason, it's hard to believe, but over 3 years ago now, that the RFP process was selected was because, number one, this board wanted to ensure to the degree we were able that the facility remained as it is. And we couldn't do that just by selling it. I mean, possible that one of the high bidders that came in would have purchased it for something else. So number one, we wanted it to see that it continued as a nursing home, and that's why we went through the RFP process. Number two, we wanted to the degree that we were able, look out for the interests and protect our employees so that the transition was as smooth as possible and that all of their rights were preserved, which includes rights, civil service rights, and a whole host of other rights that the employees have. Some of them were near retirement. Some of them were heavily vested in the retirement program, and so we felt, very strong about that. In addition, there were other elements
that dealt with adjacent land, and there were questions that were asked relative to any thoughts that a prospective responder would have to adjacent property that the county owned, whether they had interest in that, did they have interest in that perhaps for other types of services or products that the county could use, and a whole host of other reasons. So the reason the RFP process was selected was because of all of those reasons and many others. And out of that process, a preferred purchaser was selected by the committee and by this board. And now, having said that, and just so everybody's absolutely crystal clear on this, within the law, the disposition of public property in this manner is subject to what's called permissive referendum. And what the permissive referendum is it okay? The question is, it seems to me, a very simple question, is it okay that we dispose of, sell the property through this process? That's really the only question, I believe, and I'll stand corrected by the attorney or the county administrator on this. And so that's the question. That other than going through a normal bid, highest bidder, out the door it goes, we went through this process. And that part of the process is, by law, is subject to, because it's not selling it to the highest bidder, it's, may we dispose of the process in this manner? And if sufficient number of residents say, no, it's not okay to sell the property in this fashion, then at that point in time, we have to make decisions as to exactly what we do at that point. I just want, the questions were asked, and I just want everyone to understand what the RFP process is, why this board, not just the people here, but there are board members that were part of that process who are no longer here. And we have new board members that have come on since this process now goes on over many years. All of us have more gray hair than we care to admit, more today than we did then. So, and if I've stated anything here that's not absolutely correct in terms of public bidding and public law, and I'm not going to speculate on what the result would happen. I mean, events will dictate that. I just want the questions that were asked in terms of the process and why we followed the process that we did. And I know there were other board committee members and other board members here that were on the board at that time, and I would just say to you, if there's anything more you'd like to add as to why we went down this road, please do.
Mr. Hirschlip, I believe you had a question first.
Yeah, I just wanted to make a response. I appreciate the board going through and wanting to do the RFP process, because I've done a lot of those myself, so I understand the reasons. But when you get to the vote, I think it's maybe misleading to get legalistic about it. Because the fact is, people vote for a lot of different reasons. So people, if this succeeds and it does go to a vote, people are going to be voting for a lot of different reasons. They might say, well, we don't want this provided, so that's why I'm going to vote against it. They might say, I want the board to start again. I want them to start over, because I don't agree with what happened in the process. That's why we're going to vote against it. So you can be legalistic about it, or maybe people are saying, I don't want to build it up. You're right. So there's a lot of different reasons people vote. I understand legally what's up for the vote, but I just need to say that there's a lot of different reasons people might vote.
And that's why I specifically explained why we did the RFP process, and I didn't extrapolate beyond that. And just wanted folks to be clear as to why we went through the RFP process and why there's a permissive referendum. It could relate to this desk. You can decide to sell this desk, you sell it to the highest bidder, but if we're going to go through an RFP process, then we have to abide by the law as to that. And that does give people the opportunity to say, no, we don't want you to sell that desk, whatever in that fashion. And that's all, that was my only point. I wasn't extrapolating on motives or why people do different things or what results they wish from this situation. That was not my goal. The question was asked, relating to this, and I just wanted it clearly understood, you know, why we commissioned an RFP process in the beginning and what our hopes were relative to the RFP process, being one supervisor that was around back in 2011 or so.
So I have a copy of the petition, and it specifically is calling for the up or down vote on local law number 2 of 2015. And that's what you're voting on. There's no reason why you can't have local law number 3 identical, even with these same people. There's nothing to prevent that. And there can be a local law number 3. It can go through the same process. There's nothing to prevent that. Be my hope that we would we take a little more time, make sure we're comfortable with a certain person, and then go forward with it. That would be my hope. It is not my hope to have the county run the nursing home forever. But I think we can find a good, perhaps not-for-profit. And there's ample evidence there's many papers, scholarly papers that have done analysis of the outcomes for people in not-for-profit run nursing homes versus for-profit run nursing homes. And you know, I can tell you the names of any number of papers that would show that the outcomes are better for the not-for-profits in general. Thank you.
I'm not going to address the issue. I would say that's blatantly false. Effectively, I think the New York State Department of Health had a comment at some point that that non-for-profit versus for-profit, the outcomes were no different.
George, you've been pretty patient. Did you have a question? You had your hand up. I'm sorry, Skip. I said George. Skip.
I think Paul could probably answer it better than the gentleman, either one of them. Why aren't we going with a high bidder? Did they back out, or did we say no to them? It's a local company. I agree with what the gentleman said earlier, that the local people would be very well vested with this operation, and they could handle it, and I think they also would keep the money here, and they wouldn't suck people in. I listened to what the gentleman said. I appreciate him spending all his time. Sounds like a good gentleman. The thing I'm concerned about is that we do keep money here by having a local company doing it. So maybe Paul or somebody could tell me why we're not taking the number 1 bidder.
Well, first of all, the number 1 bidder was not a local company. The number 1 bidder was another individual. I think he might have been from New York. I think they had a place out in Buffalo. In the end, what had happened is like what we did with all of them was we asked for certain. Well, actually, we picked 3 to ask for certain information. The 4th, the lowest one, didn't seem to be one that we wanted to pursue, not only because of the price, but just for a variety of reasons. So we picked the top 3. We asked for information, and the number 1, the highest bidder, like I say, was not the local one, and they did not respond in the process for our information. Eventually, we didn't hear from them anymore. So that's what happened to them. And then when we looked at the other, and we went through, we had a negotiating team actually meet with the others, and we actually had presentations by each of the bidders that we're going to look at committee. It ended up that the committee determined that Centers was the one that we should proceed with based on their presentation, based on their bid, based on all the information we had. And I think it is important to emphasize, as Supervisor Conover did, that when we set out on this process, it was not all about the money. In fact, that was one of the reasons, or that was the main reason why we did what we did. We did not want to cut and run. We never did it with this facility. We were concerned about the residents. We were concerned about the employees. And this whole thing was crafted to try to accomplish that. And then ultimately, as I mentioned, when the presentations were made, it just turned out that these folks here, who were the second highest bidder, also made a very good presentation, and the committee determined that they would be an organization that would do a very nice job in taking Westmount forward. As has been mentioned, healthcare is extremely complicated today. County government and the board and just the mechanisms by which we operate make it extremely difficult for us to run a nursing home. Also, as was mentioned, the fact that we only have 1 small nursing home puts us at a serious disadvantage when it comes to dealing with the insurance companies and the other folks that you have to deal with going forward. So for all of these reasons, but as I mentioned, when we first put this out, it was not about the money. It was about trying to achieve certain objectives. We felt this company could do that job. The committee felt that this organization could do that job. The local company was, if you're referring to, was actually the third highest bidder.
Wasn't a high bidder?
No.
They were, I believe, $100,000 lower. Is that correct, Paul?
You know, I don't want to
It's correct.
provide an exact
I think
figure,
that's what it was.
It's correct. It was $100,000 more.
But they were also not willing to go on the tax map.
Well, and they also didn't want to take on cogen, so I guess there's a lot of trade-offs there.
Yeah, well, we tried to have a discussion with them too, but the board said that they didn't want to pursue it any further.
Is there another nursing home in Harrisburg? Is there more than one nursing home there?
We have an adult care, it's not a nursing home, it's Countryside if you're referring to that, but that is not a nursing home, that is actually an adult care facility.
Is that run at a serious loss?
It is. Yes.
More of a loss than less loss?
No.
Not more?
No.
But you do agree that we're talking about CNAs or we're talking about nursing assistants, and I have a nurse for a wife and a doctor for a son-in-law, and I have a nurse that's getting a bachelor's degree. There'll be no jobs at that nursing home for people like her, right? These will just be, how many RNs will be employed?
Again, I turn to Lloyd. Feel bad for Lloyd. I don't see, I mean, we're going to have the nurses. What do you have now?
I don't see you probably changing hardly anything on that. 5 during the day, supervisor around the clock.
We're in the same business. We understand each other. We're here for the residents.
Same type of staff?
Yes, yes. We're probably going to have to add staff at some point, only because of the fact that we're going to bring the acuity up, and the kinds of patients we'll take will be sicker. They won't have to go elsewhere. I mean, we spoke about that before.
So the real estate company or the LLC that owns the land underneath it's not going to be the same as the one that owns the nursing home?
Correct.
And the purpose of an LLC is for limited liability?
Well, the real estate needs to be held in a company. So one was created for the real estate, one was created for the nursing home. It's just typical real estate and nursing home transaction. It's the way it's done. So when you go to the health department, I forgot what this one was called, Westmount LLC, but the health department investigates the people behind the LLC. And so that's what they're going to be doing.
Say real estate, will one LLC own the building?
Yes.
The other one own the land?
That's correct. No. No. Land and building is one, and it's complicated. Like you said, Paul said, the theoretical beds that are there, it's the opportunity to provide the care is owned by one, and the building and the dirt and the bricks are another.
So the building is owned by you or
By the other bad guy. I'm one bad guy, he's the other bad guy.
That seems a lot like a shell game.
I'm joking.
I like that a lot.
I promise this will be my final comment, and it's only going to be 3 sentences long. And actually, I want to agree with Mr. Rosenberg. He said earlier, he says, if you make a mistake, you want to learn from them. And I always think that's a good idea. I want to read from county minutes back in 2007, just 3 sentences here. And it's talking about the cogen system over at Westmount. Mr. Dusick added that the state was very smart to finance such projects because not only was the project expected to be budget neutral at the end of a 13-year project, the savings reaped by the county would make Westmount Health Facility a much more viable facility. This point should not be lost sight of because it was a fact that nationwide nursing homes were suffering and some private homes were even forced to close because they couldn't handle the costs of operation. He stated, Mr. Dusick noted that in this instance, Warren County had taken advantage of a program that would make the Westmount Health Facility economically viable well into the future, saving county tax dollars and at the same time yielding benefits for years to come. How wrong was that? $450,000 a year loss every year since then. Thank you.
Mr. Chairman, I think that I do have to comment back on that. First of all, at any given time when you make when you form opinions or you're involved in projects, you do so based upon the best information that you have available at that time. And At that time, we had reason to believe that the state would come through on the Medicaid payments that they owed us, which they still haven't come through to this day. And before that time, we also thought, when we actually put this project together, that we would have a social services building that would be running off that cogen facility as well, which of course that has changed. So the fact that at any given point in time you make decisions based on and hold opinions based upon the best available information that you have, I don't see anything wrong with that. If you're acting in good faith and you believe, and we did believe, that this would assist in this facility. Because the other thing you lose track of is not just about the cogen, it was all the other improvements that we also got at the same time. So at that point in time, everybody thought that this was a good situation, that it would pan out. Point of fact, while all kinds of numbers have been thrown all over the place, our engineers said that only $65,000 was lost on this. And we're looking at a $3 million project as opposed to $50 or $100 million that has been thrown around by the trash plant. I think one of the problems here is that this project has not been kept in perspective. It's not been kept in perspective when you look at a $3 million project and you're losing $1 million on the nursing home just this year. You got to really put that in perspective. I don't like talking about numbers, but at the end of the day, when the tax rates occur, increases occur, and we have to come up with the money, and we can't put it into the roads, or we can't put it into the court expansion project, when we're holding on to facilities that the private sector can do just as well, or not, if not better than we can, that's what we have to think about as your county management team. That's what it really comes down to at the end of the day. So I don't have any apologies for that. We're trying to do the best we can with what we have. So I would just ask folks to consider that, and consider, like I say, put it into perspective. Put $3 million versus $50 million or $100 million. Put $3 million per expense in connection with $1 million loss this year alone. When you start to do that, you start to understand that this is not the monster everybody thinks it is. In fact, we have some real possibilities going forward, especially with Centers Care. I really believe that this company has offered us a good opportunity to bring in a well-managed company, and from the visits that Lloyd and I had to their facilities, I got to tell you something. These folks care. They care about their employees. They care about the people that are in their facilities. When we were down visiting, and we just didn't visit Fulton, we went down to New York, and we picked the facilities that we wanted to see. And when we went in there, you know what I saw? I saw management who knew the names of the employees. That told me a lot right off the bat, because if these people were strangers in their own facilities, they wouldn't have been able to say good morning by name to their employees. I saw cleanliness. I saw people in the facilities that were polite. Lloyd and I got access to every part of those facilities, and that seems to get lost. Everybody says, well, geez, that's all you did was a cursory review. I would disagree. I thought when we were down there, we got the opportunity to ask every question that we wanted to. We got to go into every aspect of the facility that we wanted to. And when we came back, Lloyd and I both, and Lloyd, you're here, you can disagree with me if you think I'm wrong. Please say, and actually, what did you think when we got back?
No, I mean, when we went down, we were given free access to anywhere we wanted to go. They knew we were coming, obviously, but there was no restrictions. Any department, we could talk to any employee. It was wide open. I mean, we went to one that was 500 beds. Can't remember the name, but very large facility. And they showed us the floors that were being rehabbed and done over versus what it was when you took it over. So we could see the progress, we could see the money that was being put into it. So we came away, we weren't there a long time, obviously, came away with a very positive feeling, though.
I'd like to make a motion that we appoint Kenny to negotiate our way out of the Siemens agreement, and then we'll give you Westmount.
Yeah. Just a couple of comments. Thanks again for coming today, Senators. I think it was very helpful. I wish we had done this a lot earlier. Taking care of our elderly, I think, is the most important part of what my job is, and I agree with Coach and his comments. I think that hit a home run. And so I don't apologize for wanting a true vetting of your company. In fact, I wear it as a badge of honor because as goes Coach's wife, goes every other person in this room. And if the citizens of this county determine that they want a referendum, get the 2,000 votes, and if the citizens of this county determine that they want to start the process over or whatever, then this is democracy, at its best and not at its worst. And they'll determine the course that we want to take. I also want to mention that I'm sure the homes look fine, Kenny, but I ran 287 stores. I was a vice president of operations. It was funny, when they knew I was coming, and I'd go across the country, when they knew I was coming, I had the best stores in the world. When they didn't know I was coming, whoa. So all I'm saying is a fair balance. A fair balance is when someone knows they're coming and to evaluate you, my district managers and store managers and staff were absolutely phenomenal people. And so I can, that's just a fair balance, that's all.
Well, for a fair balance, let it be known that we gave them as short a notice as possible.
Well,
Lloyd and I
I would
talked
give
about
one
this, so
I would give 1 day.
they could not go around and clean up big messes.
And I hear you, and I'd give 1 day notice or something, and I'd get the same. So, again, thanks for coming. You spent a lot of time with us. This was needed a long time ago, in my opinion. I wasn't here in 2013 when when you did your presentation, but there's a lot of information exchanged today. So, again, thanks for coming.
George Ryan, taxpayer. I'd just like to thank the board for doing this, and I just hope that Mr. Rosenberg is willing to hang on there, because I think he's a good candidate. I think he did good diligence to picking him, and I hope that he's our man.
I appreciate that. Thank you.
Okay, any other questions or comments, Supervisor Taylor?
Yeah, just a comment. Mr. Gannett spoke passionately about Westmount, the fact that his wife is treated so well there. But he wasn't telling us anything that we didn't know when we started this whole process. We realized that it is a fine nursing home, and we did everything that we could to try to get someone in that would run it the way we would want it run. I think centers would do that. The comment on the petition process, I support a petition process. But if it is successful, and if the referendum were successful, I've got a concern. Somebody asked Mr. Rosenberg a little while ago, hey, would you bid on this again? And he didn't jump up and say yes. I'm concerned with the publicity that this is getting, that if we go through this process and start all over again, you're not going to have anyone interested, and if they are, it's going to be a fire sale.
Appreciate those comments. Supervisor Molina.
Yeah, the only comment I appreciate, this is great. Even I learned a lot more, and I've been at a lot of these meetings for years. But the one thing that we all have to remember, what these gentlemen or anybody like them is going to bring to our nursing home is better care in some of the things that we can't handle there right now. So there are a lot of our citizens that have certain ailments that they have to go further south or north to go, and it makes it inconvenient for the family because we don't handle everything. With this group, with what I saw up there, what extra stuff they could provide and teach our workers how to handle is an asset also. And that's my comment.
Thank you. Yes.
I just want to say one thing to refer back to the statement that was said earlier that Mr. Rosenberg had his paid staff here to support him. I think that we can all see that Mr. Rosenberg doesn't need his paid staff here. He can handle himself all on his own. I want everybody to realize that we're here to let you all know that we're still at Centers. Our lives were at Centers, and we feel the same way that everybody gets that basketball felt. That our community was being changed, and that people were coming in, and strangers were going to change everything. And there was change, and some we liked, and some we disliked. But the outcome was good for our community. Our families are still there, they're still coming there, and we wanted you to know that we're still there. They didn't take away our wages, they didn't take away things. Some benefits did change. As a county employee for 28 years, that's why the county lost skilled nursing home, because they paid us so many benefits. Sorry, but that's true. And so things did change. But the quality of our care got better. We learned how to take care of the sick patients. We learned how to take care of the wounds. We learned how to do all of this for not just our residents, but for our residents' families. So we're here to let you all know that. And change for us, but for the better, and for our community that we're in. Just add to that as well. Just one last thing, it's a quick story, but it's meaningful. It's relating to the gentleman that said you need to visit and show up at the facility, but also unannounced or unexpected. The CNA staff does not know who I am. When I go there, I meet them every week and I meet my mother. I was just sharing a story. I dressed in ripped jeans and a sweatshirt. They don't know me from Adam. They don't know I'm an employee. I scrutinized everything and I watched. I met a very sweet CNA, the sweetest one I've ever met at any weekend. I asked her story. She's a local girl, and she just got her first apartment, and yet she was offered another job at a different facility with more money, and she turned it down because she loves where she works and she's attached to residents. That, for me, meant the world because she's already attached to my mother and is giving her excellent care, and my whole family, we all feel the same way. So I just wanted to share that because it was an unannounced visit, nobody knew who I was, and I was very impressed with this attitude.
Anyone else? I would personally like to thank Mr. Rosenberg and his team. I thought the presentation was excellent. As Supervisor Beatty alluded to, much needed. This actually is the first meeting that we have videoed, so it is available. If anybody does have any questions or any of the public has friends that have questions, please contact me or anyone here at the county, and we can get in touch with Mr. Rosenberg for any future questions. I would like to thank also all of the supervisors for attending. This was a nice turnout. The staff from the other nursing homes, as well as the public. I hope you got a lot out of this, and I also want to thank our local media and papers for doing this entire thing. Yes. You cutting me off. It's only been 4.5 hours. Okay, motion to adjourn made by Supervisor Conover, seconded by Supervisor Westcott. All in favor? Aye. Opposed? Carried.